Okay, let us pray. Father, in the name of Jesus, we thank you for this time. We thank you for the purpose of this workshop. We pray, Lord, that you guide us and give us wisdom so that we are able to learn from our findings. In Jesus' name I pray. Amen.
Thank you very much. We're going to modify the program a bit. The items, I think we don't have them ready in audio form. So I'm going to skip that bit. We have in this room, we have the principal of the College of Business and Management Sciences, Professor Eria Hisali. And we have the Dean of the School of Statistics and Planning, Dr. James Wakadala. We have Mr. Fred Gavirano, the Commissioner in the from the Ministry of Gender, Labor and Social Development. Mr. Gavirano, you're very welcome. We have guests who have joined us from different places. We have, maybe I would just say we can do a round of introduction quickly so that for us who are here, and I would also request that the people on the online audience can be able to share their details so that we can be able to know where you're connecting from. Thank you very much. Let me just request maybe Dr. Nduga Patricia to be able to help us with the introductions. We also have our team that we've been working with here. Associate Professor Betty Kwagalas is going to introduce herself. We can use one microphone, and I think we have a sanitizer. We can be able to sanitize it. So let's start with the Associate Professor Kwagalas. And then we have everybody here in the room introduce themselves as we start off our program. Thank you.
I'm from the Department of Population Studies.
Good morning, everyone. My name is Jen. I work with the Netherlands. Good morning, ladies and gentlemen. My name is Scott, and I represent the Travel and Risk Action Network.
Hello, everyone. My name is Benanches Balajiwar. I work with the Sexual Reproductive Health and Parental Rights.
Good morning. My name is Cynthia Najimawaso. I work with the Ministry of Gender and Taxation as a principal probation and welfare officer. My name is Sanchez. I work with Professional International in the section of child protection. My name is Cecilia Ford. I work with the
Good morning, ladies and gentlemen. I'm James Okadala, Dean of Statistics and Planning. Most welcome. Good morning, Principal of Business and Management. Good morning, my name is Fred Gavirano. Good morning, ladies and gentlemen. David Chisito, IT Support School of Statistics and Planning.
Good morning. My name is Marco Jumba. I'm a resident administrator.
Good morning, everyone. My name is Patricia Nduga from Department of Population Studies.
Thank you very much. We have some people who are joining us, the online audience. I think you can be able to type your details, we'll be able to hear from you. So at this moment, I just want to invite the Dean of the School of Statistics and Planning, where our department of business studies is ordered to come and make opening remarks, and then thereafter, I would like to request him to invite the people to come and make opening remarks. Thank you very much.
Thank you, my colleagues. Once again, good morning, ladies and gentlemen. We warmly welcome you to this examination workshop of parent-child communication, the code name PCC, on sexual and reproductive health, particularly focusing at the bordering areas. Colleagues, such an exciting and informative research and dissemination is really aligned to the strategic direction of our dear Makerere University. But also, if you look at what our colleagues have been able to share with us, or they will share with us, it is very strongly aligned to SDG 3, where we are talking of having good health and well-being for everybody on this globe. Our colleagues, of course, we know very well that issues of health are so strongly emphasized also in our National Development Plan 3. So really, what colleagues are going to share with us are results that will inform not only knowledge or skills, but also will guide in terms of policy engagement and policy direction, particularly on issues of sexual and reproductive health in this country. Colleagues, I have not had a chance to read the report fully, but I'm very confident that the results that came out are really pertinent enough to guide the planning or health planning in this country, particularly in vulnerable areas like in the bordering districts of this country. This is not my day to make so many speeches, but it is my humble submission to thank, for example, the team for the wonderful job they have done, led by Dr. Wanda Stephen. Can we put our hands together for the job well done? I also take the same opportunity to thank Minister of Health, Minister of Gender. Yes, Mr. Ngabiano, the Commissioner. Thank you so much for joining the research team by providing the policy eye or the technical eye from the ministry. I also thank the sponsors for really supporting us in this exercise, but more importantly, we thank our mother university, Makerere University, through our boss, the principal of the college, for giving us a conducive environment and supporting us in all ways to be able to effectively execute on our mandate of research, besides teaching and supervision. Finally, this is an appetizer for us to move forward. I have been whispering to my boss, and he will be offering us some monthly stipend or monthly facilitation to be able to be holding monthly seminars or seminar series, such that such good products are shared university-wide or nationwide, but also it will be an opportunity for us to get feedback from the stakeholders to be able to improve on our research outputs. So with those few remarks, colleagues, it is my humble duty and honor to invite the Principal College of Business and Management Sciences, Professor Area Study, to come and give his remarks. Thank you so much, colleagues.
Thank you so much, the Dean, School of Statistics and Planning, our colleague, the Commissioner from the Ministry of Gender, Labor and Social Development, the study team led by Dr. Stephen Wandera, our friends from different organizations, both government and the non-state, colleagues from Makerere. I've seen me, our friends from the press. Ladies and gentlemen, good morning to you all. I'm going to summarize my remarks by just saying a few things. One is to congratulate the study team led by Dr. Stephen Wandera for one, winning the grant, but also being able to successfully execute the work in a timely manner. Congratulations to the study team. Number two is to appreciate the government of Uganda through Makerere University Research and Innovation Fund for supporting the work. I guess it was partly supported by RIP, right? Yeah, so I want to appreciate the continued support that we get from the government of Uganda to address these important policy issues. My colleague, the Dean, alluded to the importance of the subject. I relate fully with his comments, but I also want to re-echo one of the points that he raised, the one of forming teams involving or including people from the policy making world. That is very important because it is a very good entry point into the uptake of the research findings, because you have now a very clear channel to the policymakers. And I want to encourage all of us doing this kind of work to always set up our teams in such a way that we get colleagues from the policymaking world to be part of these teams. Now, ladies and gentlemen, the subject that has been under study and whose results we are going to start receiving in a short while is a very important and interesting subject. Now, as we go into the dissemination and as we agree on the way forward, the key action areas, I want to leave with you a few things, a few questions that we all need to be looking at, especially as we look at parent-child communication. My first area of interest in this subject, and I am now going to speak really here as a non-expert, but we all know the pressures now that we face as society. We have pressures to balance work, we have pressures to survive, we have pressures to look for money here and there. Now, if these are the pressures we are facing, how much time is left for our families in general, and how much time then is left for parent-child communication. As we disseminate and as we look for the action areas and as we try to interest ourselves in the way forward, I want us to pick interest in this particular area. We might give very good suggestions, but we have to anchor these suggestions on very good context. We have to be as realistic as possible if our suggestions are going to work. So how much time, in view of the pressures that we have, is left for us to closely interact with and guide our children? Number two, we know that with modernity in quotes, there has been a considerable breakdown of the structures of society as we knew them years back. The communal responsibilities, the responsibilities that children were not only for the nucleus family, but children belonged to the wider community, to the wider society. And within that framework, within that setting, everyone in one way or another took responsibility for the good upbringing, for engaging these children. How do we look back and pick one or two things from those practices? I don't entirely agree that everything in those practices was bad. I'm sure there is something that we might need to learn from those practices and see if at all something can be done. It can be in a different setting. It can now be done within the setting of schools or in some other arrangement, but let us reflect on that, because it enables us to, of course, work together as society. These children belong to all of us, and if there is anything going wrong, we all suffer those consequences. So we need to begin reflecting back and try and see how much we can learn from those practices. But now related to that, how much of those values have been passed on to the current generations? We know they used to happen. There was quite a lot in terms of communal upbringing of children. And we might also be, as we suggest action is on the way forward, it might be interesting to know how much has been passed on from those practices to the present. As I conclude, once we understand the context properly, then it will guide us on how we can now come up with an appropriate institutional framework, an appropriate arrangement to foster improvements in parent-child communications. Obviously, it goes without saying that any lapses in proper upbringing, of which PCC is just a component, is going to have dire consequences for our society. So, colleagues, as we do our dissemination, I thought I would just challenge ourselves on a few of these areas, but most importantly, let us get the contextualization very well, so that we can now anchor our recommendations, our action areas on a very solid context. Ladies and gentlemen, I think with those few remarks, I will leave it at that, and I wish you the very best in the remaining part of the discussion. Thank you so much.
Thank you, Mr. Principal, for your remarks. Let's give him a clap offering. So on the program, we are supposed to have somebody from the RIF Secretariat. I was informed that Dr. Sabrina Staka was supposed to join us physically. I don't seem to see her here. And I would wonder if we have somebody who is on the online audience, maybe from the RIF, MacRIF, GMC. I do not. Okay, 9:45. Okay, so right now I want to take the opportunity to just modify the program a bit and invite Mr. Gavirano from the Ministry of Gender, Labour and Social Development to make just a few remarks. Then after that, we'll be able to have somebody from MacRIF when they're ready. And then we'll be able to have a group photo. And then I know that Professor Hisali is very busy. He's going for another meeting. Maybe we can do a group photo now so that we have him, and then we can have the remarks from the Minister of Gender, and then Dr. Sabrina Staka. Thank you very much. So the online audience, I would say that you can allow maybe some video of yourself. David Chisitu is going to take a number of screenshots to be able to handle the online audience. So we're going to have okay, so thank you very much. We'll take this about 10 minutes, then we'll be back. Dr. Sabrina Kitaka, you're welcome. You're very welcome. Thank you. It's good to see all of you. And members who have just joined us, I want to welcome you once again to this very important meeting. We just finished a group photo, and I think David has also done screenshots of the people who are online. At this moment, I would like to invite Dr. Sabrina Kitaka. Let me just confirm with how to introduce her properly. She's a senior lecturer. Okay. Dr. Sabrina Kitaka is a senior lecturer of pediatrics and child health, and she's a member of the Grants Management Committee. She's going to represent the chair of the Grants Management Committee of Makerere Research and Innovations Fund. And so I want to take this opportunity to invite her to make her opening remarks on behalf of the GMC. You're very welcome, Dr. Sabrina Kitaka. You could.
So good morning, everyone. Good morning. You just had a nice picture, and I hope you enjoyed that opportunity. I'm sorry I'm coming in late because I'm attending another meeting for the Uganda National Academy of Sciences, where we are dealing with inclusion and equity. And for me, this comes at an opportune time for me to be the one called to represent our chair, Professor Fred Masagazi, who is unable to come. But he said to me, he'd like to congratulate you on your dissemination. You all know that RIF and GMC has, offered over 700 grants, and would like to congratulate you for this far you have come. For me, this topic is very pertinent to me because as a pediatrician, as an adolescent health expert, this is the day-to-day that I do every time. We know that a lot of girls have become pregnant, especially during the lockdown. And one of the studies that we did in Kamuli and Wakiso clearly showed that the girls who are becoming pregnant had very poor parent-child communication. As an adolescent health expert, this.
Okay, so I think we are back. So at this moment, I just want to invite our colleagues who have joined us a bit when we had started and finished introductions to be ready to make some introductory remarks. And let's give a clap offering for Dr. Sabrina Chipaka. She had a that statement was very impressive. To have, we need to have bigger ears and small mouth. That's quite a statement. Thank you so much for those opening remarks, and we're very glad that the government of Uganda, through the Makerere Research and Innovations Fund, was able to support this one. And so, just for your information, in our midst we have the National Children's Authority represented here. We have maybe let's just by show of hands, we can see the ED is here. We have National Population Council represented here, physically present. I saw Jolie, Zoe somewhere there. We have invited people from the Child Fund, Compassion International. We have a Health Child. I'm sure maybe they're online. We invited Joy for Children, GRAN, which is a network that coordinates children at risk. We have Makerere University, we have MacReef, we have people from the media, just by show of hands for us to identify them properly. Okay, we have, I think, like about 2, if I'm not mistaken, but we invited about 4 media houses. We have had the principal of the College of Business and Management Sciences and the Dean of the School of Statistics and Planning. We have Ministry of Gender, Labor and Social Development, who are our key collaborators and partners. Let me just see by show of hands, they're going to introduce themselves, but at least we have 3 in the room here, maybe others are online. We have people from, we invited some people from the Ministry of Education and Sports. We invited people from the Ministry of Health. Then we had National Children's Authority, I've already talked about that. We invited people from Plan International and also somebody from the police unit. We are expecting religious leaders. We have one from the Uganda Muslim Supreme Council. I guess he's Mr. Haj Abdul Nasser Ogezi. We invited stakeholders from UNFPA, UNICEF, World Vision, Straight Talk Foundation, SRHR, and so on, and TPO. I'm not sure if we have somebody from TPO present, but I know they'll be coming. So I'm very glad that all of you are here. Maybe if I've not mentioned the name of your organization, just not by intention. I want to give an opportunity to members in the room here, those who have not introduced themselves, to just have a few remarks, say your name and your organization, and from that, we'll be able to hear from Mr. Gavrano from the Ministry of Gender, Labor and Social Development. And then we go into the science. We can have a break and have break tea. Patricia will alert me when it's ready. And then we move forward. Thank you very much. Over to you.
Good morning, ladies and gentlemen. Good morning, ladies and gentlemen. My name is Zoe Juliet Nabawanuka. and I work with National Population Council as a national program officer in charge of sexual and reproductive health. I'm glad to be part of this meeting.
My name is Reproductive, I'm a journalist with Radio 1. Yes, good morning, ladies and gentlemen. My name is Abdul Nasser Mabizin, the team leader of the Foundation for Muslim Youth and Children. Also work with the under the auspices of the Better Positions of the Council and affiliated with the Interreligious Council again.
Good morning, ladies and gentlemen. My name is Franco Tolea. I'm Assistant Commissioner for Children Affairs, Ministry of Gender, Labor and Social Development, Department of Youth and Children Affairs.
Good morning, ladies and gentlemen. My name is Martin Chiza. I'm the Executive Director of National Children Authority, and we are very happy being part of this meeting.
Morning, ladies and gentlemen. My name is Akampuri. I'm the Project Assistant Officer. Girls Not Bright Uganda. I'm here with
Good morning, colleagues. Justin Wasabo, my name is.
Okay, thank you very much. We have everybody. So I think we can go for a break tea if it's ready. If it's not, we can start the presentation. But oh, sorry. Mr. Gavrano, please come over. I'm very sorry.
Thank you, Dr. Stephen, our moderator. The Dean, School of Statistics and Planning. You are welcome. We are very happy to be with you. Dr. Sabrina, we're also delighted to have you. Thank you for leveraging a minute to be here. There are very many people online waiting for the science. So I also want to say two things, and then the rest I will say at the end, because the PS is brief, he's unable to attend. My director was also invited. We discussed, is also to attend online. We will be attending 2 meetings online, but at the end of our dissemination, I will give a comprehensive kind of statement from the ministry on behalf of the PS. I'm just here to say you are all welcome, and I'm here in 3 positions. 1, as a commissioner, technically I head the Department of Youth and Children, and I'm happy I've been joined by 2 senior colleagues, because the findings are going to help us as we conclude our sexuality guidelines for adolescents out of school. We also help us to work with Ministry of Education to address some of the missing links in the education sexuality guidelines for children in schools. I think the cultural leaders, the religious leaders, parents have been raising some concerns, and some of them will be responded to on the basis of the scientific study findings, which were here today. 2, thank Makerere University, represented by the Dean and a member of the grant committee for the award. Of course, they worked for the award. at competing level, but we are grateful for that. 3, thank Makerere for the paradigm shift. In this regard, I mean, the academia working with government, especially the technical officers at the level of strategic management in regard to fostering the national research agenda. I think it becomes now easier for us when we are writing policy briefs, writing cabinet memos, and also when we are planning in line with the National Development Plan 3, this is what we want. I recall when Makerere research team from the department, Dr. Stephen is heading, came for a letter of recommendation. I engaged them. Why should I be responding? Why can't our ministry be part of the study? And the idea was, I explained to them that when you engage us, when it comes to utilization of research findings, it is more easy for us to quote and also move on with what you found out scientifically. And I'm very happy for the last 3 years, you are the first team from Makerere to use this kind of approach. And where I've been, I'm encouraging them. On an annual basis, we receive guidance from Office of the President, where ministries, department, agencies submit areas of research. They call it a research agenda for the country. And I believe what we researched all contributes to that. And when we are developing the National Development Plan 3, we use the life cycle approach. And there were issues concerning people at different ages, 0 to 5, 6 to 9, 10, 15, up to 8 years and above. So the issue of parent-child communication in regard to the challenge we have of teenager pregnancies and early marriage is very, very, very paramount. We shall hear from the findings, and then we should compare with the cost of inaction. If we don't do A, B, C, D, what are we likely to lose as a country in terms of our sustainable development, which we talk about in the Vision 2040 and all what we know. So I want to stop here by saying we are together, and I believe by the end of the day, those online will have realized that we have made our contribution in regard to the human capital development pillar in program within our National Development Plan 3. I thank you.
Thank you, Mr. Gavirano. I would like to say that I want us to go to the presentation now so that we have the online audience also benefiting something before we have a break. I'll be allotted when we have break tea ready. Thank you so much, all of you. In the program, if you just check, you must be having a copy of the program. We have cleared quite a number of items. So we are going to the real stuff that we need to address. And I'm going to share my screen right now so that we can connect. Right here. Yes. Okay, so I think that we are good to go. So my name is Stephen. I hope that the screen is being shared for the online audience. Oh, okay. Let me share the screen right now so that we have the online audience moving with us. Okay, so I think the screen is coming up shortly. My name is Stephen Ojambo Wandera. I'm the acting head for the Department of Population Studies. And together with a team of my colleagues in partnership with the Ministry of Gender, Labor and Social Development, where Mr. Fred Gavirano was our contact person. And we have been able to come this far. Let me just request my colleagues to stand up for recognition if they're here. Associate Professor Betty Kwagalat, she's seated over there. I know there is Patricia, Dr. Patricia Nduga, she's at the back, very busy again, but you can just wait. So Dr. Peter Chisache is unwell. He was actually supposed to present, but he must be online. he requested that he attends and participates online. Dr. Martin Bonye was on his way. I spoke with him this morning, and Mr. Fred Gavrano. So I want to, in terms of background, we have had quite a lot of work done as a country. And we know that globally, young people face multiple sexual and reproductive health challenges. I'll be using SRH to refer to sexual and reproductive health challenges. But one of the striking things is sexually transmitted infections, of course, including HIV. And then we have unplanned pregnancy. Now, in Uganda, we know that the median age at first sex is about 17 years, according to the Uganda Demographic and Health Survey report. We also know that the teenage pregnancy is about 25%, and this is a very high rate. Now, when it comes to the border districts in Eastern Uganda kind of has a very poor maternal and child health indicators compared to other regions. So teenage pregnancy being at 25% is not very good for the country. And then we also know that there's some bit of transactional sex, especially at the border districts. Now, SRH is part of the SDGs, as the Dean has already mentioned, and I won't go into the details. We are fully aware about that. Now, what is the missing link? We know that traditionally, parents were really not very direct in addressing sexual and reproductive health communication. Okay, so I think there's a delay in the changing of the slides, maybe because of the network. You bear with us about this. I hope we can have a better experience. So we know that parent-child communication about sexual and reproductive health is a protective factor for adolescent SRH indicator. There's enough scientific evidence to prove that. Now, the challenge is that there is very limited evidence about PCC. I'll be referring to PCC as parent-child communication. So for the sake of, it's three words. So there's limited evidence of PCC on SRH in Uganda. We have some studies that have been done in Tanzania, some studies done elsewhere, but we also have some studies done in Uganda. But a lot of work has been focused on children who are in schools, and there have been quite a number of interventions done by civil society organizations. And so we really wanted to know the prevalence and the determinants of PCC for Eastern Uganda border districts. And we also wanted to know the barriers and facilitators. And lastly, we wanted to be able to have a feel about the policies and the programs that are currently, of course, focusing majorly on schools. And Mr. Fred Gavrano has already talked about the issue of, he has already talked about the issue of having a policy and programs for school-going children. And he has already indicated that there is a need for policy on out-of-school going children. And so, let me just hold on for the online audience so that we can move together. so that you can. Let me just check. Okay. I hope that the online audience is able to follow. When I change here, there seems to be a time lag. Is that okay? Let me request maybe if one, okay. Okay, so we can have maybe, if you can email to David and then he can put on his computer so that we can use that. Okay, so one of the things we wanted to do was to estimate the prevalence of PCC on SRH in the Busia and Tororo districts. There are quite a number of districts in eastern Uganda. So we know that the indicators for Tororo and Busia are a little bit different from the others. So we purposely selected two districts, Busia and Tororo. And then we also wanted to know the determinants of PCC on SRH in Busia and Tororo. And we also did some work about the facilitators and barriers. In terms of the methods, we did a cross-sectional survey. Of course, the study sites I've already mentioned, the way Tororo and Busia. And we collected both quantitative and qualitative data. We used an approach where we were interviewing a parent-child dyad who would go to a household and interview the parent, one of the parents, and then interview one of the children. If there were several, we would randomly select one of them who is eligible. And our eligibility criteria was by age. And by this time, I think we know that we were still dealing with the COVID-19 scenario, and most of the children actually were at home. They were not going to school. So we did about some focus group discussions. And so in total, we had a survey of 600 parents and 600 children. And we analyzed these data sets separately. So what we're going to share in terms of results will be showing the part for the children and then the part for the parents. So the data collection was affected. I just need to mention that when we started on this in 2019, of course, COVID-19 came in and most of the activities were halted. Even the Uganda National Council for Science and Technology at some point actually stopped all recruitment of study participants. So that's why we are disseminating 3 years later when we had the award in around September 2019. So those are some of the challenges. So we did take data collection on 9th to 23rd May in 2021. This was part of the training we had for the research team, and it was held at the College of Business and Management Sciences. We recruited people who were graduates and we trained them rigorously for about 3 days and had a pilot test in one of the districts in Eastern Uganda. That was an Amaingo district, because we wanted to have a feel of how the tools were, the ones which were translated to the local languages. This is an example of the pilots that we did. And one of the ethical requirements was that we needed to provide all the research teams and the study participants with face masks and ensure that we have the sanitizers and so on. We had this study approved by the TASO Research and Ethics Committee. I'm aware that some of the members could be attending online. And then, of course, as part of the requirements, we had to have the study registered by the Uganda National Council of Science and Technology. And then, of course, community entry is that when we went to the districts, we had to get clearance. But at that time, in May 2021, the COVID-19 situation was not very good. And we had to get clearance beforehand to be able to go to the districts. So we had to visit DHO's office, RDCs, and so on to get clearance before traveling to the districts. And then, of course, at the village level, we needed to get permissions from the local council leaders. And then, of course, voluntary consent from the parents, informed consent. And then for the children who are below maybe 18, we would be able to get assent. We could get assent from them. And then also talk to the parents. So we, as I've mentioned, we purposely selected Busia and Tororo as border districts. We visited about 4 sub-counties and 20 villages in total. We had 2 sub-counties in Tororo, that is Malaba Town Council and Mela. And then from this, we selected about 10 villages. In Busia, we went to Dabani. Dabani is a bit of peri-urban, and Buhehe. Buhehe is a rural. So we also wanted to have a scenario where you have at least urban populations and then have some rural populations. And then when we went to the village, we would sample randomly households that were eligible with young people of the age category we were interested in. And so, as I've already talked about this, we did the parent-child diet. I've already talked about the sample size. So let me just share the results now. So we're going to have them in 2 phases. We'll have results which focus on the parents, and then those which focus on the children. David, are you trying to share something? Okay, I could stop sharing this. Okay, good. Thank you very much. And so we have the parents survey results, and then the children survey results. And later on, my colleague, Associate Professor Betty will come up and share the findings from the qualitative side. Okay, so let's move to the next slide and look at the results in details. Okay. Waiting for you, it's not moving. Next slide, please. Let's move on. So we're going to share the descriptive characteristics of these respondents. As you see, this is for the parents. We are starting with the parents, which had a sample size of about 600 of them. Now we had an overrepresentation of rural areas. You can see 92% of the participants were from the rural areas. There was some kind of, again, 72% were women. They were mothers. Not showing, okay.
Just remove the presentation, then you just share the screen.
What do you want?
I want to share the screen, so what you see on Zoom is what you should see here. No, don't stop. No. You want to share the Zoom. Yeah, you shared like what you're projecting.
It's already.
Yes, it's this that I want.
Okay.
Should be able to see what you're seeing on Zoom.
Okay.
Maybe stop this sharing.
One minute.
Don't share.
Okay, let me hold on. We have the technical challenges with IT. Sometimes things happen even when you don't invite them, but that's okay. We'll be fine. Okay, so David, I'll just give you a few minutes to sort this out. And then are we there yet, David? Just give me a moment. Okay, so thank you so much. We switched the computer so that we can take a look. I want to pick up from the results. Okay, so I was saying that for the parents, we have 90% rural areas, and the reason is because then for gender representation, we have about 72% with masters for female candidates. The mean age for parents is about 44 years with the standard division. But in terms of categorical distribution, we can see that the most is about 30 to 39 years. The other interesting thing is that most of the parents had about more than half of the parents. Now, what we did tools for measuring parent-child communication. And so we picked up some of those international evaluative tools for measuring this kind of parent-child communication about sexual and reproductive health. Now, these questions are yes and no questions with 0 and 1 categorizations. Normally, we asked about lifetime experiences. So we asked the parents whether they had ever discussed with their children about the following questions: about HIV, or AIDS, abstinence, STIs, body changes, sexual pressure, body touches, conception, contraception, and condoms. And what we have here shows that most parents, actually, you can see over 70% are comfortable. They had at least in a lifetime discussed with their children about HIV and about abstinence and STIs. Now you can see the pattern here is that parents are talking about things that are life-threatening. So if something is life-threatening, then they want to use that as a scarecrow to tell the children not to engage in sexual activity, because if you do, then there is a life threat. And so some of them have, you can see that at the extreme right, you see a pattern where contraception and condoms is really something parents are not comfortable talking about with the children. Now, we also had questions about recent. Recent was about 6 months before this happened. And the pattern is the same. Even for discussing items, you see the same pattern. So parents, at least in the last 6 months, they talk to their children about HIV, abstinence, body changes, STIs. But again, contraception and condoms are really things that parents will very shy to discuss. Now, what we did, each of those indicators, we generated an index. So if you look at the green color, we have lifetime discussion about PCC, rate, and then we have recent, the last 6 months, and the extreme right. Now, the self-reported is a question that we asked. It was a single question that we asked parents if they have ever discussed any of these stuff and SRH information with their children. And then the one which we call a computed in yellow color. Computed is derived from the several indicators that used to measure parent-child communication and sexual and reproductive health. So when we look at the comparison, we actually just see that the simple question we ask the parent and the one we generated by asking the sexual indicators, the difference is very minimal. So they are giving us almost the same. So we can comfortably use either a single question, but also we can use the computed one where we are aggregating from different indicators. Now, the other thing was we wanted to know whether parents are comfortable discussing these kinds of information with the children. And as you can see in the first pie chart, you see that about 24% were not comfortable. Actually, we're not comfortable discussing these kinds of information with the children. And then we see, we asked whether it is a good idea to discuss with our children. This is really to measure the attitude of parents. And we can see that yeah, it's a good thing. And then there is this issue about having primary schools teaching SRH to the children. And the parents are very happy that it's should be fine. Now, this is a bit confusing because at the same time they're saying, it's good to discuss with the children, and it's also good for the schools to go ahead and teach this information to the children. So we had a question where we wanted to know what could be done to help the parents discuss SRH issues with their children. And as you can see, over 70% say that they need training. They need training on how to communicate this kind of information. Because, you know, we have a culture whereby SRH information was delegated to extended family members, especially the uncles and the aunties, the senators and coaches, as we know them. And so parents really comfortably want to share, they want to get that involved. But the challenge is that this cultural practice is really fading away because of rural-urban migration, urbanization, and so on. If children are spending all the time in school, then the uncles and aunties then have a very limited window of opportunity of this kind of business. It is good if we have training. And then related to that, there's an issue of materials of curriculum to use. So this you can see that they're very related. And of course, others were saying they need support groups. We try to do a model of which factors were affecting the determining parents' ability to discuss with their children, especially for the last 6 months. And of course, those who had an attitude which supports discussing with their children, who said it's okay to discuss SRH materials with the children, we can see that they have the response of discussing with the children. However, we seem to have a challenge with the observations because the high observations and the wide confidence intervals. This is something we're still investigating to see why this is happening. So, but perhaps the reason could be that most of the parents were in support, over 90% were in support in support of having this kind of discussion. So it's like a common constant. The other interesting thing is that if the daughter got pregnant, then it would be a window of opportunity to open up this conversation. Now, this is a bit of dealing with the symptoms of the problem. You wait when somebody gets pregnant in the family, and then the parents begin the conversation around this topic. So it's a little bit, in terms of prevention efforts, it's a little bit late. It's a late intervention. But it was something that we found that when the girl gets pregnant in the home, then that's a window of opportunity for discussing these matters. We tried to look at the industry comparisons, and we saw that these parents in Toronto were doing more discussions compared to the parents in Lucia. When we had the district stakeholders representation in Toronto, we got a glimpse of what the results will be. Partly, we got to learn that there's so many non-governmental organizations that are doing sexual education. And I think there is also a dynamic of cross-border trade. Cross-border trade makes the parents very busy, and they do not have time to actually engage with their children. So I want to switch gears to the children's survey findings. Now, we again look at the distribution of the children, and the pattern is almost similar to what we saw for parents, because we were doing parent-child diet. So whenever we did the interviews, we also report with parents and the child. So the distribution is really the same, with 93% from rural areas, and we had for the children there's kind of an equitable distribution. About half, slightly more than halfway, the girls, and the mean age was about 14 years for these children. We had some who were 10 to 14 and 15 to 19. In terms of district distribution, it was nearly the same. Again, when you look at the results for lifetime discussion, lifetime parent-child communication about SRH1 children, we see nearly the same pattern as that of the parents. The children are also saying that we ask the children, okay, in your lifetime, have you ever discussed this kind of things with your parents? And so the children are saying like 54% we're talking about abstinence, nearly half we're talking about HIV or AIDS, and then climate changes. So we see the same pattern, but when you look at the extreme end, you see that condoms and contraception is something that even the children are saying they really discuss with their parents. So the pattern is nearly the same as that of the parent. And so we also asked the children to report about the recent PCC about SRH in the last 6 months. And the pattern is just the same. The children also say in the last 6 months, at least their parents were able to discuss with them about abstinence. Now you see abstinence is top on the list. When we saw the one for parents, we saw that it was HIV or life-threatening conditions. But the children are telling us that, you know what, the big thing that we our parents telling us is abstinence, HIV, and somehow contraception and then condoms is really the last item that the children are saying their parents discuss with them. Again, we looked at the sort of reported the one question and then the aggregate of the indicators. And the pattern is really the same as that with the parents. Now, for the children, we asked them about sexual behavior because we wanted to know, okay, so there is discussion, right? But what about sexual behavior of these children? And you can see for the children, nearly a quarter of them say that they have ever had sex. And in the last 6 months, 95% say they have had sex in the recent past. And this is actually getting way beyond the national indicator. Of course, we just need to state that this is a sample of 600. It's not a national study. And I think people have been talking about COVID-19 situation, escalating the incidents of sexual violence or sexual abuse in homes and families. This statistic points to that. I don't want to raise an alarm. We also asked children whether they had used contraception in their last sexual encounter, and they said about a quarter of them said yes, they have used the condom. And for contraception, you can see about 17%. Meaning, we have 83%
are having sexual activity, there's nothing happening. So we asked about the reasons for sexual abstinence, and the children told us that, okay, about 4 in 10 were saying that it's really personal choice. You can see 3 in 10 were saying that parents are very strict. Parents are very strict. So that's why they're abstaining. Okay, so those are the critical things. We have education at some point. Religion has a very limited say there. And this is something for us as religious leaders to reflect on. Maybe it might be much personal choice and a personal reason. The part for abstinence. We also wanted to know about HIV testing among the children. And you can see that the distribution is about 56%, at least they know where to enter the HIV test. But very few have ever tested. Here the 2 in 10 are the ones who have ever tested for HIV. Remember, sexual activity the last 6 months is 35%. But the ones who have ever tested for HIV is 19%. That points to the gap. We also asked children about 4 or 5 indicators for measuring STIs in the last 12 months. And children reported about 16% were saying they had pain during urination. Others, about 10% said they had abnormal discharge. Now, the determinants for PCC recent parental communication about SRAs among children. One of the things that was interesting is that different from parents is the issue of residence. And children who are in the urban areas compared to those in the rural areas, they're more likely to discuss with their parents, more likely to discuss with their parents about sexual and reproductive health. Now, this is rural-urban dichotomy. So this indicates that rural children in the rural areas are more disadvantaged compared to those in urban areas. The possible explanation could be access to media, television, phones, and many other things. And then the other issue is that the boys were more likely to discuss these matters compared to the girls. Now, this is a bit disturbing because one would expect that it's the girls who are communicating, who are discussing with their parents. But this is a bit reversed. And then the other issue, when you look at age, you see that the children who are 15 to 19, they are more likely to discuss with their parents compared to, of course, the young ones, 15. And of course, that is expected because maybe parents are feeling like, okay, we cannot engage in this kind of discussion with these kids who are 10 to 14, they are still young. And then we also wanted to measure the impact, the association of mobile phone ownership in the household and this kind of discussions. And as you can see that children who came from households where they owned this mobile phone, they were more likely to discuss these kind of things compared to those who didn't. And again, the pattern for the children is the same. Toronto, children from Toronto district are having more conversations about this matters compared to those who see it. So at this point, I just wanted to provide, I don't know if we're going to have a break. If it's ready. Okay, not yet. So let's have on the program, we are supposed to have paper and discussion. And I want to invite Martin to come and moderate this section. You're welcome.
Good morning, ladies and gentlemen. My name is Martin Williams. I work in education studies. I'm one of the open school investigators. Stephen, thank you so much for that wonderful presentation. And I don't want to waste any more time. I want to quickly dive into the discussion of the findings that Stephen has just presented. Patricia, may I request you to capture those feedback from participants? I am going to be as open as possible, so if you have a reaction at the presentation, I bring the microphone. Okay. Professor Betty.
Thank you very much for a great presentation. It was quite impressive and detailed. My question or concern is your definition of children. As far as I'm concerned, a child is anyone less than 10 years of age, well, 0 to 19. And I think the population that you studied was adolescents, 10 to 19. I think the more we call them children, the more they lose out on the special needs that they have. I'd also like to know which children or adolescents, 35% were having sex in the last 6 months. And if they were younger, did they have condoms that were suitable for them? I noted with interest that 24% of the parents were not comfortable with discussing sexual and reproductive health issues. And probably no wonder 24 to 25% of adolescents in Uganda are pregnant before the age of 18. I probably missed your recommendations, maybe they'll come later, but I thought those would be very important. First of all, recommendations to the local community that you dealt with, but also recommendations to the policymakers. Thank you.
Thank you, Dr. Sabrina. I think all of us know Dr. Sabrina, so I have missed out on appealing that when you want to make your point, you tell us who you are, where you are, then you can go ahead.
Thank you so much, Stephen and colleagues, for the recommended work research. My name is Mama Eva, work with the National Population Council as a National Program Officer and a Family Health Department. Unit of adolescent and reproductive health. My concern is on how to hear parents and also children. Did you capture their views? Do we have that information anywhere in your research? Thank you. Yes, my name is Zoe Juliet Naranka, National Population Council. I want to start by thanking Makerere University and Dr. Stephen Mandera for the presentation. I have 3 concerns. The first one is from the findings, parents expressing the need to be trained on delivery of sexual reproductive health. And this may not go to the researchers, but Ministry of Gender, Labor and Social Development. I just wanted to know how well issues of sexual reproductive health if issues concerning sexual reproductive health are integrated in the parenting guideline. Also, the findings have also informed us that parents are more interested in discussing sexual reproductive health after their daughters have gotten married, have gotten pregnant. But in Mr. Fred Gaverano's remarks, he emphasized that in the Human Capital Development Program, what is being emphasized is the life cycle approach, but particularly preventive measures. So is it possible for us to have this research presented before the working group so that this also informs the planning in the next financial year? Then we have a hot cake with us, the parish development model, and we are looking at increasing households at the lowest level, the parish level. I don't know who is better placed to have such findings shared with the two districts, particularly the parish development committees of those two districts, so that they can also be informed in their interventions. Then about the element of inclusion, we are in an era of leaving no one behind. And I wonder how well were children who are HIV positive or with any special needs. Do we have any findings from such children? Thank you.
Thanks so much, Franco. It's my name. First, I want to appreciate these findings. Actually, the findings relate so much to what we do also find out in some of parts of the time when we go to the field. Now, my concern was in the presentation that parents tend to shy away to communicate to children about sexual and reproductive health. But there's so much which they want to, but they need the what? The knowledge, the training. And then again, when you go to the findings of the adolescents, the findings of the adolescents, majority of them, not majority of them, many of them, I can't get the percentage, are saying they have used the condom or they have the knowledge of the condom. I wanted to see whether the research, where this information about the condom these adolescents got from. Is it from the few parents who are able to talk to their parents about HIV/AIDS and how to prevent them, or these adolescents got it from another information saying that not from the parent? So that when we develop an action on training the parents, we should be able to relate this to the what? To the gap in information to the parents. However, the big one, the concern about whether the reproductive health is integrated in the any health, it's quite mainstream, very well. It's segmented in the parenting health, like that one.
Thank you very much. I would also like to add my voice to the findings, the initiative carried out here. My name is Martin Chizam from National Children's Authority. I just wanted to give some clarification. One, on the percentage of the parents talked to. Did we talk of 72% as mothers, then implying fathers or 58, something like that? And I would like to express my fear that that's actually where we begin creating a gap. Because when you look at the findings, children, the male children are tended to talk more, and when you get to our traditional observations that we normally come up with, is that you will discover that the fathers tended to sort of shy off, they don't bother so much. So I don't know why we went to the 72%. vis-a-vis the 28. That was one. Then the other one is the study took place around 2019. 2021. Still, that's fine. We have the government, we have policy, where I think my colleague, the commissioner, assistant commissioner, has alluded to that. It has provisions, key priority areas of child well-being. I don't know whether the team had background to this information, this policy that is currently our hot cake as a nation in promoting child well-being, so that our findings would not maybe be a duplication of areas that we have already, or could add value to this. Then lastly, the slide was so off very fast. I looked at the religious leaders as being very low in terms of maybe interventions to help our children grow up in the maximum protection that they deserve. But we also needed to look at the cultural institutions as very critical in the communities out there, because they, if I may use the word, they confuse the communities to a great extent. Thank you.
Thank you. Stephen, you want to take those 5, or do we can we take another 2 or 3 before you respond? Okay.
Thank you very much. My name is Reproductive. I work with the Sexual Reproductive Health and Rights Alliance, Uganda. I'm pleased to be here. One of the biggest issues in parent-child communication is gender communication, as in differentiating communication or the information given to a girl child and a boy child. I don't know whether that was captured, but just building up on the executive director of the Children's Authority, there is still a gap in father-child communication, and that is not only here in Uganda, but basically worldwide, yet we are talking about male involvement. I don't know whether we can dig deeper into this data to provide information for some kind of analytics about that. Then the other issue is about the parents' attitude. Results show that parents are willing to do communication on SRHR. And then we have the National Sexuality Education Framework and the other related sexuality education being delayed and blocked and deterred from rollout by government. I don't know whether this research can provide information and also be based on to give a backup on the expedited start of the sexuality education framework and the related, including a school health policy, because everything around those policies, adolescent health policy, are around the issue of parents not willing, religious leaders not willing. Yet we are seeing from the findings that religious leaders actually are not doing enough. That is what the results are showing. I am also surprised to see that boys are more likely to talk about these things. Where do they get the information? Because we are talking about parent-boy communication. Where do they get the information? Yet the fathers are less involved. Yeah. So there is quite a lot. Thank you.
Thank you. We usually have a challenge, moderating this session. I only have 15 minutes, but it's usually hot. This parent-child communication has become hot. That's why
request that we keep our submissions precise so that we can try to manage the time. Otherwise, there is a lot that I know is going to come from it.
All right. Thank you so much. Eddie Waraka speaking. I'm excited to be here. I would like to congratulate the research team for the impressive work that you have so far done. One observation is that the findings actually appear to give us a completely a new way of looking at this whole subject of parent and child communication. First of all, we have always thought that parents are sort of are reserved. They don't want to speak to their daughters or sons. But what we see here seems to suggest, a dynamic something that is happening. And I think if it can be confirmed, it is a very good development. So thank you so much about the findings. The question that I have, sexual and reproductive health looks to be a very big concept. And I'm wondering how you were able to translate it to the communities without biasing them. So that is one thing that I need to hear from you. And do you think you were able to exhaust the major aspects that you think at some stage maybe you may want to prioritize? Because sexual and reproductive health is, I'm not an expert in this area, but there is sex education, so to speak, things to do with sexual health, access to services. Young people are also into the business of manufacturing children, so childbirth, and mention it. Then psychological and mental well-being in relation to sexuality or things to do with sex. So maybe you may want to tell us if you are confident that you are able actually to exhaust that subject. Thirdly, about communication, I would like to hear from you if parents were mindful or sensitive about age segmentation when it came to communicating very sensitive issues. I see we have another presentation, and I think lots of things have to come out, but I'll be interested in knowing also under what circumstances they were communicating. What were the motivations? Did they have a specific time or place? Because this subject appears to be so sensitive, and how they start, when, and how they do it, I'm very much interested in learning about that. Thank you so much.
Thank you so much. I'm feeling from New Vision. I've just quite talk about the consequences that these children suffer. For instance, how many of these have interfered with pregnant, how many contracted STIs and the like. Then how was the 14-year-old able to get, where were they able to get this condom? Talk about. And then it also doesn't talk about the perpetrators. We know very well what happens in homes sometimes. Children are exposed to sex in homes, but since this is also the border districts, we know the activities that happen there. So tell us who exactly were these perpetrators exposing these children.
Okay, one more question. Two? Okay.
Thank you very much. I want to commend the team on the work well done. And I'm Winnie from Compassion. And my comments, or one of my comments, we look about the determinants of PCC and decide that parents are willing to open up and speak to their daughters after they become pregnant. And what is taking my mind is, what about if the boys make girls pregnant? The parents actually come out and talk. And then among the suggestions to enhance PCC, our parents said that they take training and then a curriculum to be guided. So I'm thinking among the things that could be added there is grooming in sexual abuse as one of the topics. From experience, that is where most abuse is coming from, grooming in sexual abuse. And then we talked about the reasons for sexual abstinence and religion scored lowest. And I'm wondering, all these children come from homes and they all have religious affiliations. Does that mean that the parents have dedicated their role in bringing up children spiritually to the religious leaders? Thank you very much.
Yes, my name is Abdul Nasser Magazine from the Interreligious Council of Uganda. I want to commend Stephen and colleagues for the work done. Anyway, let me start with the reason for abstinence and the impact of religious leaders as being low. Religious leaders need capacity building in this area. And because most of them concentrate on leading prayers, then sermons, and the sermons probably concentrate on different areas, but not this one. It is there are a few religious places that offer children engagement and youth, just a few. So most of them, we concentrate on prayers and sermons that talking about different issues, not issues about children. I think the parents have taken their role in taking children to religious places. Actually, we have neglected the boy child and concentrated on the girl child. I think we need to take it as a point, as others have been taking it as a point, because we have problems at home, as especially parents who are in the working class. We leave our children with mates, and every other time we keep on changing mates, and the values are impacted into our children by the mates, and whichever mate who comes at home brings in other values. So at least if we can have values being pinned, we agree on certain values in our homes, and they are pinned somewhere because the era has changed. We don't have time to talk to our children, and the children are being spoiled in that. Thank you.
Thank you for your very wonderful questions. I think, Stephen, you want to take them on. You feel free to pick up any other person within us to respond. You have to. I think after this, after Stephen, we are going to go for a tea break. And then when we return, we will hear from the ones that are online, the ones on Zoom. We have some questions, so some questions and comments that have come through that also need to be addressed. Stephen, over.
Okay, thank you very much. Questions are very good and very extensive. I need to say that we actually stopped. We have like three sessions of presentations. We did the first one. There is a part for qualitative findings, and then there is a part for policy program where issues are taken care of. I will try to see my colleagues. I will invite them more if they can supplement and pick on some of the items. The definition for children, can you raise about our definition? I think the definition for children, we have the, there's always a dilemma of need to parent, adolescent communication, need to parent child communication, and we have seen those two concepts used independently. But I think we're following the less than age 18 as a definition. So 35% have sex last 6 months. If younger, did they have suitable condoms? That's a big question. We did not think about that. It's a nice thing to think through in the next stages.
We can control for age.
Yeah,
and we see, yeah.
24% not comfortable discussing with our age. I think I didn't get that one clearly.
You asked if we have recommendations for community and for policy. There's a slide I have, there's slides I have. It's about 1 or 2, which is going to come. So I would hold that. How to hear parents, this is from NPC, how to hear parents, children, we have their info. Yes, we do. We have qualitative results and we have details about them, but you know, when you're presenting, we cannot disclose them here, even in the report. But we have, but you have something? Disabled. Oh, hard to hear.
Yes, sir.
No, I think that is something we did not take into consideration. So that would be a limitation of our study. Our parents need training, issue of gender, that one, when it comes to policy, Mr. Gabriano will take that on. I'm sure he has not taken it down. Parents want to discuss when daughters get pregnant. Yeah, you know, there is always a trigger. From the qualitative findings, you realize that people wait for something on TV. If something happens on TV, and then they use that to discuss. So this is like a setback. I think even for boys, when they impregnate someone, then it's time to. Minister of Gender Franco erased condoms, where the children get about condoms. We didn't ask for these details in this survey. Is the analysis segmented? We try to control, we try to control for age, but it was not really big for the children. The ED NCA, 72% of mothers were included in the study. Where are the fathers? Normally, when we do the interviews, the fathers are either border riders, so they are doing business, or at the border, they are actually doing business, so they are not in the home. This was a household survey. So when you go during daytime, you are not finding them down the training center. So that explains why we have over some. But the point you're raising is a very quick one. It's a very quick one. Spend the time. We talked about the national child policy. Mr. Gabriano will handle that. Religious leaders, I think he has tried to address. And I like what you're saying, because you say that we interviewed religious leaders. So we took care of that, and we always make sure we invite them in all the meetings from inception to December. So, but what you're saying is actually funny to what they said. They really want capacity. And just like you put it, they focus on prayers and sermon preparations. And once in a while, using abstinence message, but the details really, cultural institutions. Yes, we had, I think in Corona, we had interviews with cultural leaders, and that information will come up. Financials, gender in communication, was that captured? I would say we had a question about whom do they prefer to talk to if they are boys. It's just that we're not presenting the results. But there's somehow, but it's somehow we ask questions about it. Father child communication, male involvement. Yeah, that's a big issue. How do we get our fathers involved? How to get the boys on board? It's a big question that all of us can do. National Sexuality Education Framework, it's your area. Where the boys get the info when fathers are less involved. Yeah, I think that's a big dilemma. It's a big dilemma. It's a big dilemma. You saw the issue of mobile phones. Mobile phones is an issue now. Social media is not very careful. It can be a tsunami. Mobile phones. Something we didn't find a little more, but it is something that we know it's Professor everyone actually give a new perspective there. It's good news that parents actually in some form discussing, but they just don't feel confident. SRH this concept, did we translate it to the communities? Yes, translation, we need translation of the tools. But I just want to pose a question to all of us, how can we say it in our local languages? Sexual and reproductive. In our local languages. It's a challenge. We tried our
Many
best,
words.
but it's quite a challenge. It's a big animal. We have to do something about it. Did we exhaust communicators? Not really. We didn't exhaust them. Like you said, implementation, yes, I think we try to do that in controlling for age. And the water countries, were they communicating? I think we didn't have details. We didn't ask for. Cecilia from New Zealand, how many STIs? We had a slide which shows that. It's just that we can't go back to the but we have. Prevalence, I think I remember about, we asked self-reported. And you know, with self-reported conditions, there's always a more because of social design. So even if we say 9%, the problem is big. Okay. How many pregnant? I think we must have had a question about this. I need to double check with the perpetrators. We didn't ask details about the perpetrators. That's true. Really compassionate international determinants of PCC parents discussing when they become what about the point training and growing in sexual abuse, helping these are suggestions. Lastly, from IRCU, he gave an explanation. Thank you, Mr. Mageti, for giving this very good explanation. Neglect of the boy, working class parents, change mates, yeah, these are all. I think maybe my colleagues watching and one see if we have some
I just feel we needed to do the presentation.
Life cycle approach. I think some of the ideas are more recommendations which we shall look at when it comes to the last slide. Recommendations, policy considerations. But what I say, government of Uganda under the guidance of the National Private Authority, we use the life cycle approach. And the life cycle approach, we follow the age cohorts, the needs of each age cohort, from 0 age up to the scenario stage. And some of the issues that the research findings tell us here lead to what is there under the social analysis within the National Development Plan 3 under different age codes. The idea of presenting to the technical working group responsible for human capital development is a good idea. And I link that to the PDM. When you look at the PDM, there is a pillar on social services where the Ministry of Health and other line ministries have a role to play. I think as we keep refining the manual, the implementation of the PDM, these are areas that we should be integrated in for the community consumption. If you are talking about community members coming up to benefit from the parish support under the PDM financing mechanism, then these are areas that we have been taking for granted that people really need to go, even in a small group. So I agree with that. And I recall being tasked to contribute on the development of content under the community mobilization and mindset change. And I made some input on that. So when it comes to operationalization, good enough, Dr. Sabrina, last week we were in the West, Southwest, we are formed now community development officers working closely, working with the health workers. Interestingly, the health workers don't know what the community development officers have been doing since we got independence. Apart from facilitating them to go running around talking about mobilization. But now we have integrated capacity building for both. Under USAID support, they're implementing a project called Keep Children Safe and Healthy,
and we have found the linkage coming out, intersectoral linkages, community, facility, community, and I think that's where now we are going to build. The issues of mental health, psychosocial, we are more known to the health workers, but we have found that the CBO, who are more like social workers at that level, cannot deal with case management without knowing the regime of HIV, the 1999. When I asked some of them, do you know what 1990 means? They said, oh, we are percentages score in class, but then now there is a big paradigm shift in terms of integrated capacity. So that one will be addressed. Now, I picked a question on, yes, Executive Director, National Children Authority, Martin, was the study informed by the National Child Policy. I think that's why I was there. And I remember the heads of departments who were here, one of them.
When I went with the Makerere Academia team to Busia and Tororo during the entry point meetings, it was easy for them because I was telling them that they have come to do a study whose findings will inform us in terms of what even cabinet has directed us to do, not as a ministry, but as a country. So we are in line with some of the cabinet directives we are implementing. And in that cabinet directive, they directed that parenting should be mainstreamed into the current and future government projects and programs. So, Madam, from the Population Council, you were spot on when you asked about the PDM. And as a ministry, we have constituted our committee to oversee implementation of the parish model, which links with the overall PDM coordinating secretariat, Ministry of Local Government. My duty there is to use this kind of evidence-based, research findings to get what we want as a country. Then cultural norms, I think it was raised. We also have a cabinet directive on cultural norms. This one came out on the 5th of October, 2020. I was in the cabinet at State House. And the president listened to our presentation on the report in regard to Uganda's progress on implementation of rights and welfare of the child. And later, as a parent, at the head of the nation, he said, Ministry of Gender, can you do a cultural audit study to find out those cultural values, norms, perceptions, attitudes that really infringe on the rights of the child? And he even demonstrated some of the already institutionalized cultures that in one or another really infringe on the rights of the child. And this is the issue of early marriage. We all know what's happening. Some cultural institutions, and I'm very happy, the pilot was done in Mayuge, like Obwacha Wazinga Wabusoga. Think 2016 or 17, they held a meeting of all cultural leaders. I attended it, 366 cultural leaders. And one of the pronouncements they came up with was male involvement in maternal and child health care, the issue of men, accompanying the pregnant mothers to health facilities. Another one was containing the social ills, including child marriage. So the findings from the two districts, when we shared with the key district leaders in the Busia and the Tororo at the district headquarters, they concurred with us. And of recent, I was in Western Uganda, kingdom like Toro Kingdom, when we were disseminating the national child policy, they have said, okay, government, you can have an overarching national child policy, but can we be supported to customize the national child policy so that we also deal with some of these cultural barriers that really are a hindrance to the well-being of our children? And that's what we want. And you can only do that when you have such kind of scientific findings. Bwacha Wazinga Wabusoga invited us to help them to come up with a Busoga, focused policy under the national policy in regard to addressing the well-being of their children. Boys versus fathers. I think the research finding reminds me how I grew up. My father was a trucker driver. I really spent a month with my father, until he retired, and a few years after retirement, he passed on. The issue regarding sexuality, it's mother who would find me either talking to a girl along the footpath, and she would, intimidate me and saying, you pregnant her, you will carry her. That is the kind, So in reality, it is not true that the boys are free with their fathers talk about sex. In most cases, you get those rude reminders from your mother, from the mother, other than the real father. And I agree with you, I may not recall the name, that the boy child, even there in Busia, when we were disseminating, the girl child was featuring prominently, but we are reminded about the need to balance the issues of the boy child. Maybe the academicians here and Sabrina, the consultant, when you do a study, I recall at the last end, there is that section recommendation for further research. More things can be dug out, building on what we did not. Because when you have a study, there are those parameters within which you are studying. You are not going to study on each and everything. But we will come on what you are raising. Some of them can inform us as a country, even other scholars who can pick interest and partners to do more studies to inform the whole country on what we are not able to find out within the time limits and the resources that we have. Thank you.
Thank you, Mr. Fred. As Fred says, this research opened the Pandora box. That is without doubt. When we were disseminating in Busia, in Tororo, that's what came out. Clearly, that is what we are seeing here. Areas for further research, since there are so many, we didn't exhaust everything. We are happy that what we did, what came out of this research, has created food for thought. And hopefully, there are going to be additional studies to beef this up. I don't want to keep you hungry. I want us to go for a tea break. When we return, we will decide whether we want to continue with addressing the comments and concerns and questions that have come through the Zoom, and also whether we can ask some people to call in. Or we first present the qualitative results, and then we deal with the rest of the questions after that. Let's go for it. 10 minutes, 10 to 15 minutes. Yeah. Then you can also carry your tea. The key, I think, is as we are moving out, the first term of the light. The bathrooms are downstairs.
No, only in HDMI or audio. So what nothing we allow them raise their hands. Then you pick one at a time, otherwise you can't do random.
Ladies and gentlemen, I think in the interest of time, we are going to have 1 minute tea break. I'll therefore be inviting Professor Organa to come and present the qualitative findings on the facilitators and barriers of PCC on SRH. You can continue enjoying your tea as you listen.
Are we still having problems? No. We are good to go. As long as I can scroll it. Yes, you can. Okay. YouTube guys, I'm recording. Okay.
Okay. Is it still morning? It's afternoon. Good afternoon, everybody. Okay, good morning. Okay, this is we complemented a study, a survey with qualitative findings. So this is what I want to present. We had a lot, but we picked out the facilitators and barriers, PCC on SRH. So among the facilitators, one of the key ones which has been emphasized already this morning is a good parent-child relationship. If a parent has a good relationship with a child, then it's very easy for that child to tell their parent anything, okay? So that was observed in the border districts. Then another one was close monitoring and keen interest in children and their behaviors. So of course we've seen the issue of parents being busy, but if a parent is keen and they are paying close attention to the behavior of the child, then they are able to pick out maybe the time when they should speak to this child. We also found, like it has been stressed earlier, that mothers were making a lot of effort to communicate sexual and reproductive health issues with their children. But of course, men were not participating. As guardians and parents, they had a limited role. So although the mothers are not doing a perfect job, they are trying. So one of the mothers from Tororo said that when the daughter, when she started to dress badly, I realized it was time to have a talk with her. Okay, so she observed the behaviors and then she knew it was time now to talk. We also found, according to the reports from the participants, that education was a key facilitator, because parents who are educated are more knowledgeable and they have, what do you call it, self-confidence and boldness to speak about these issues. So those who are not educated, you know, you never went to school, but your child is in S1 or P7 or something, you even wonder how you're going to communicate. So that was a key challenge. And then, it was a facilitator. High levels of education were a key facilitator, but literacy was a challenge. Then support from religious leaders and institutions. Although we are saying that religious leaders, according to the survey, played a minimal role, some of them actually worked through the parents. They spoke to the parents. And in some cases, they spoke to the children and guided them on what to do. Some religions, okay? So one of the key informants told us this, that when given opportunity to talk, I tell parents, have time with your children and have what is called a family altar. Talk to them, even if you may not know what the Bible says, tell them to abstain until they have finished their studies. So maybe this is where they are also getting the emphasis on abstinence. Okay, so some are actually playing a role and can even play a bigger role. Those were some of the facilitators, but we had several barriers. The cultural norms that are associated with sexual and reproductive health that relegate the role of this communication to the extended family was a major barrier. If you parents are too busy to talk to your children, then why do you expect an auntie somewhere who may not even be resident in that place to talk to your child? So that was a key challenge. One of the key informants said, parents feel that things to do with sexual health should not be discussed between a parent and a child. They consider this to be a taboo. So the culture says a parent should not speak about those issues with a child, these cultures in these areas. Especially if it's a parent of the opposite sex, then it's a no-go area. And yet we know, actually we are seeing, we saw that the communication was over 70%, but the issue is what is the content of that communication? Why isn't it being effective? Maybe that's another question that we need to ask, because we see that the problems persist. Then another one, also related to culture, was cultural reservations, like the taboo-related issues that lead to use of incomprehensible figurative language and omission of culturally sensitive topics. So parents, some parents communicate, as you saw, they said they communicate, but they do not use a language that the children understand. They beat about the bush, you even fear to, in fact, in the dissemination, one of them said, you are talking about condom use. Some of us even fear to go and ask for a condom at a shop. What did they call it? The parents fear. So even they don't want to mention the word condom. So how do you expect them to talk to children about these issues? Even if they saw the need, it will be difficult. So one of the children, the young people told us that my mother says, if your mother does not teach you, the world will teach you more. Now, what do you pick from that? Okay, she's not pointing to a specific issue, but she's beating about the bush. So that was also a challenge. We communicate, but what are we communicating and how effective is this communication? Then another challenge was, barrier rather, was parents' lack of adequate knowledge, appropriate skills and approaches to communicate to children about SRH. I think this is self-explanatory. Then fathers and male guardians hardly participate in communication about sexual and reproductive health. I think this has already been stressed. one of the female children that we talked to said, "Daddy is harsh. He does not like discussing such issues. When it comes to such issues, he says, go talk to your mother." Okay? So even when they are available, they do not communicate. Sorry. Then another key one is the late initiation of communication about sexual and reproductive health. So parents wait until there is a crisis. That was stress, actually. I think Dr. Stephen also talked about it. So we found out from the group discussions, we talked to some children, and one of them said, it was an in-depth interview. One of them said that they initiated sex at around 12 years. Okay? So by the time you think of talking to this child at 15 or 16, it's too late. So it's better the parents start early. Then another key one is poor modeling by parents. Communication is, Dr. Sabrina, oh, she left. Yeah, Dr. Sabrina emphasized that we should listen, talk less and listen more. Yeah? So communication is not just us speaking. It's also, you can even communicate louder with your actions. So if I'm a mother, and many of them actually were single mothers, and you are getting a partner every night, and this child is saying, and you're in those small places, those small houses, what do you expect? You can still talk, but this child is seeing more from what we do. Okay? So that was the key challenge, especially in peri-urban areas near the border. Then there was an astounding practice that some of us had never heard about. There is something called disco matanga. Had any of you heard about that? Yes. Now, disco matanga, people fundraise for funerals, but they do that at night, and they have a disco where young people participate, and that disco does not only involve like only the funeral, and the disco doesn't only involve adults, but even very young children. Okay? So after this disco or during the disco, during that time, young men and boys rape and defile children. And this is widespread. Actually, one of the key informants was even crying tears when she told us about this. So this is a very serious issue that needs to be addressed. And then a rampant one was also the level of poverty in these districts. They are supposed to be business district, but there's a lot of poverty. So when a parent is poor and you can't provide for your child, you can't even provide sanitary towels, it may be very difficult for you to tell this child not to do. Maybe when you can't provide everything, in some cases, actually even food was a challenge. So sometimes children are sent to hawk things on the road, and in the process, they are deceived by people who have money and they get abused. And in some cases, we are told that the children actually bring supplement provisions for the household. So the child brings in food at the end of the day or some money. And then the mother may not even ask where the money came from because she may know, but because of poverty, this is let go. Then of course, there was also an issue of defilement where children are defiled, but parents are compensated, so the cases are not taken up. So it seems like there is some kind of impunity where this issue is concerned. And during the dissemination in Tororo, we were told that there's even a subculture. I don't know whether it's a cultural issue where men, I think they are men, the men say that children are like, they are like mangoes. These girls are like mangoes. Some of them consume them when they are ripe, but others opt to eat them with salt when they are raw. So they are saying that it's okay to defile a child when she's not an adult. So this is also something that is needs attention. Then we've already been talking about busy parents. It's not only us who are busy, Even people in villages and those border districts are busy. So actually, we are told that some people even go away for months and leave children, sometimes with a father, other times there is no parent at home. So such children become vulnerable. So maybe an issue is, if we say we are going to work for our children, and we don't have time to talk to them, then why are we working? Because we'll come back when it's too late, okay? So that's also something to think about. This is a summary of what we were able to touch. There were many barriers, but these were the key ones. Thank you.
Yeah, thank you, Prof, for that presentation. I think we can take 1, 2, 3 questions. Yes. So we get into the policy presentation first. Okay. Fred, we will present that. Yes, it's right over there. It is here. The recommendations. Okay. Yeah. I was getting confused. Yeah, no. Okay. Yeah, we haven't reached the Fred's slides, but take us through the recommendations.
Based on our study findings that Professor Kwagala has just taken us through, these are the recommendations that we came up with, and some of them were proposed by the participants. We had key informants, but we also had the children, the parents, and yeah, so one of them that comes out clearly is to encourage parents to discuss SRH comprehensively, but also to include what are they discussing. We emphasis should also be on contraceptives and condom use amidst the cultural inhibitions. Yeah, because we found that most of the discussions focus on abstinence. That's the easier bit to talk about. But things that condoms and contraception, that is like a taboo. So even when these parents want to shy away, these are things they actually have to bring to the table. Target rural areas for PCC interventions. I think Stephen mentioned that urban areas, there is more media exposure. The phones, the social media, parents in urban areas are more educated, more exposed. They could easily have a better relationship with their children, unlike rural areas. But again, keeping in mind that these are border districts, they are very, very unique. What we found in Busia and Tororo can't compare to what you find in Wakiso and maybe Mukono, okay? Professor Kwagala has said that some of these districts, what we found out is a mother can leave her home and go work as a housemaid for a year. So she has left her children with the husband, the father. But the father is also busy. So this is like a child-headed home, okay? So targeting rural areas, starting at an early age, having those age-appropriate conversations at an early age, not waiting for 15 years, but say at 8, at 9, at 10, you start initiating this slowly. And over time, you'll notice that this child, even the relationship grows with time. They can confide in you.
targeting females. One of the findings in these areas was that males mentioned being spoken to more. That is very unique. We know families target girls. A girl is likely to get pregnant, a girl is likely to contract HIV, maybe, you know. But here the males were being spoken to. But we held a district dissemination in February. We went to Tororo and shared these results with the key organizations, selected key people in the districts. And a possible explanation was why males were being talked to in those districts is that the study sites we went to, some of them were key mining areas, where there's sand mining taking place, they are fishermen. These are male, boys are the ones doing this. And also, they are, by them being involved in trade, they are more vulnerable. This boy is going to impregnate someone's girl because they have cash, they have some money that they can lure young girls. So parents kind of, I think we are not able to see. So these boys needed, the parents felt the need to start these conversations with the boys. So there is need to target girls, train parents to make them more comfortable to discuss SRH with children. Again, this goes back to the training manual. What is it that we are talking about training, but what is it in this training manual? What do we want to bring out? Yeah, culturally, our parents are shy, they're embarrassed. These parents can't even go for a condom. How about talking about a condom with their child? Going for a condom, buying a condom at a pharmacy or at a shop, etc. Equip Muslim leaders and parents to discuss SRH matters. Good enough, we have a Muslim representative here. Maybe he'll guide us on how this can be done. And yeah, this was based on the kind of information we had from the Muslim key informants. Their messages were kind of coming in at a later time, maybe focusing on marriage and all that, unlike these early initiations on different issues. Explore online learning, cell phones to increase exposure. Maybe having, we have UNICEF represented, we've had, they've done those mobile reach outs to different issues, maternal health, child health, maybe messages on a monthly basis to some of these children or to parents. Targeting Busia. Busia is also a very unique district. We found out that most NGOs are targeting Tororo rather than Busia. Maybe the policymakers could have a say on this, because you would find that there's concentration in Tororo. Everybody goes to Tororo. Why are they leaving out Busia? And they kind of have similar issues. They're both border districts. Target persons in business sector, busy people. Parents are very busy, and those with concerns, those who have concerns about risk of pregnancy. This was like a song in these communities. The girls were very vulnerable, they were high risk. So finding ways of targeting such busy parents was a key thing. Thank you very much. I'd like to invite Mr. Gavirano to take us through the policy implications, and then we'll have the Q&A. Thank you.
Maybe before I handle that last bit, Professor Kwagala talked of some parents not being on ground ready to provide care. Very interesting. In the two districts, we found out that some mothers leave their children, their families, and their husbands and go across to work in Kenya. And some take 3, 4, 6 months without coming back. So what happens? The girls in the adolescent age bracket really become so prone to defilers. And whereas we have been knowing that
men usually go to work to look for money long distances. Personally, I didn't know that mothers in the border districts really cross the border. All along, for us from the child fraternity, we thought we are having the child trafficking in the form of house girls crossing the border. But here we have a situation. In fact, it is a very comprehensive study in regard to parenting, where mothers, we are even told where some women are away for 2 years. So what happens to their husbands, even the children they leave behind? It's more of a national concern, if not a crisis, that we didn't know until we undertook the study. So very quickly, in regard to policy implications, that SHR policy and programs which focus on parents and children and adolescents out of school should be put in place. And this way now we have to target leveraging some of these programs in the ongoing government projects and programs. And the PDM, much as it's being spoken as the last bullet to address household poverty and that, we need to come out with sub-programs that make communities active rather than remaining passive recipients of government services. And some of the programs we are talking about could be more community-based, simple, but highly impacting. And this is where we need the NGOs and the development partners in regard to mainstreaming SRH in policy and programming. 2, that we integrate SRH stroke parent-child communication in formal and informal education curriculum. And from the findings, you could tell that even the parents are saying we need more training. It could be not necessarily training in the sense of being in lecture rooms and what, but imparting knowledge about what they don't know. And when you look at our program, which used to be functional literacy, I think now it has a new acronym. It's called ECOLEW. Franco. Yes, this is the area now where we need to make a high-level presentation under the community mobilization and mindset change. The way one of the participants made an observation at the beginning, so that we even integrate the SRH and PCC, even in that content for the adult learners, it should be there. And when we are working with the NGOs that support informal education, we need also to put it there. We as a ministry, we conduct informal and formal skilling of the youth in and out of school, especially those out of school. At Intao, at Kobrin, in Napak, we are soon finalizing rehabilitation of Mobutu Youth Skilling Scheme. We are going to work with the Ministry of Education to make sure that we integrate this in our training curriculum. 3, integrating SRH stroke parenting, child communication and parenting interventions. We have already talked about that. Yes, Franco, it is there, but based on the findings, we have to address the missing links if they are there, and then we tighten and have a more comprehensive parenting guideline. We have other community manuals that also bring into account issues of parenting directly or indirectly. So we shall work with our partners, and I must thank UNICEF, represented by Mr. Agustin Wasago here, for a job well done. Because last quarter during the COVID, much as we were under lock, they were able to give us emergency support, and under the emergency support, in over 1.5 billion we got, supporting institutions, caring, institutionalizing alternative care and all that. One of the areas of support has been disseminating the parenting guidelines under the Department of Family and Culture to local governments, in line with the cabinet directive that we should support local governments to implement the parenting guidelines. Then integrating SRH stroke parent-child communication in guidelines for government flagship projects and programs I've already talked about. So I'm not going to repeat myself in the interest of time. Then we are looking at building capacity of various workers and social welfare workforce at the national and subnational level in SRH. I think I talked about this when Dr. Sabrina was still here. And we are seeing excitement among both the social service workforce and the health workforce. And it can work. We have models. In countries like Brazil, I happened to visit Brazil on a Uganda delegation. We found a community work at the sub-county level, equivalent to the local government in that country, is well knowledgeable, skilled, experienced, and knows across all the dimensions of a human being, what we call holistic human development at that level. So we shall continue to work with the health workers, with support from our development partners to have all around community extension workers that can help us in regard to SRH. Agriculture officers need to know this. Forest officers need to do this. It's no longer a monopoly of the health workers, neither a monopoly of community development workers. That culture and religious institutions take lead on addressing barriers, that one is key. And we are working closely with the culture and religious institutions. Madam Lydia Wasula is here. She knows that they are representatives on the National Interministerial Committee for Implementation of the National Child Policy and its implementation plan for 5 years. And their roles are clearly demarcated. And as a ministry, we take a lead in working with them. We offer both financial support we get through partners like UNICEF, USAID, UNFPA, but also we provide technical assistance in terms of capacity building their staff and also having dialogue meetings with them. Apparently, I think with Lydia, we are on the national regional consultative meetings on teenager pregnancy and child marriage in view of revamping the expired teenager pregnancy and child marriage strategy for the country. So they are being very supportive, and we believe we can do more than we have been doing. Another policy implication that we should include SRH and PCC indicators in the minimum performance indicators of the ministries and local government annual performance. Those who have worked with government, especially at subnational level, or have read about how government performance is monitored, they assist annually. And we feel that beyond our advocacy as a ministry to have the well-being indicators, we should outrightly come out with SRH and PCC. And I'm very happy, the Uganda Bureau of Statistics with support from AfriChild, which is another local NGO that works with the Ministry of Gender based at Makerere, they are supporting government through the Ministry of Gender to come up with indicators to measure government investment in the area of children's rights. So we are going to refer to the National Child Policy and other existing guidelines to make sure that we integrate that, and then we guide local governments also to invest in SRH, and we work with Ministry of Local Government to ensure that on an annual basis, we look at what interventions they planned for, how much was allocated, how much was realized. And that's where now the National Children's Authority becomes very, very paramount, because statutorily, the authority has an overarching role of assessing the investment and also advising government and partners on the strategic direction in regard to realization of rights of the child. Another policy implication, defining status, we should conduct regional research on SHR to inform legal and policy reforms. And I think my colleague from the Alliance, that's where we are saying this has triggered some things that can really attract either additional funding in form of competitive proposals or partners that have a research and policy agenda in their bilateral support to the government of Uganda. Yeah, I will leave that acknowledgement to our Dr. Stephen. Come and acknowledge, or you acknowledge when everybody has finalized making a submission, form of a recommendation, a question, seeking for clarification. Thank you very much.
Thank you very much, Mr. Governor, for that engagement. I want to acknowledge the government of Uganda through the Makerere University Research and Innovations Fund, MACRIF, for providing the funding and the support for us to be able to do this study. And we look forward to more engagement. We also want to acknowledge all our different stakeholders, first of all at the national level, for coming today to really engage with our findings. We are going to have a discussion after this, but I'm very glad that you showed up and honored our invitation from Makerere University and the Ministry of Gender, Labor and Social Development. We really respect all of you for creating time to come. And we also want to appreciate our study participants, the children, adolescents, who were able to give us valuable feedback and input. It was a very engaging process. We learned a lot from them. We reflected as a result of engaging with them. We also want to appreciate our research team, which is composed of Associate Professor Betty Kwagala, Dr. Martin Boni, Dr. Peter Kisachi, Dr. Patricia Nduga, and myself. And I also want to acknowledge our research team, which also had the fieldwork support team. They did a good job. I know some of them actually are listening in online, and we're very glad. And I want to say that let this be the start of conversations about parent-child communication regarding sexual and reproductive health, and let's not close the conversation. I'm very glad that this is an opportunity for us that we have worked together with government, and as a university, of course, we are part of government, but on the other side, and this is a day where policymakers, researchers, and programmers meet to dialogue on critical issues that affect the country. Of course, we are also cognizant of the support from development partners. For example, UNICEF, UNFPA, and many others, just to mention a few. And we want to really honor our religious leaders for making it today, and people from different non-governmental organizations, different ministries, departments, and agencies of government. I also want to recognize our very good friends, the media fraternity. We appreciate your work. I believe that this is the start of a conversation that we're going to have even from now onwards. Thank you very much, all of you, and God bless you. So I would want to invite Mr. Freddy Gagliano and Dr. Patricia Nduga to take us through a little of the answering of some of the questions that were raised earlier. There were questions from the online group, and maybe there are more questions generated right now from the issue of barriers and facilitators, and also things to do with the policy implications. There were questions from the online team that were raised, and some of them, I believe, have been answered by these presentations you have done. So I just want to request that Dr. Nduga and Mr. Fred Gagliano, if you could help lead this, and then we'll have closing remarks from the Ministry of Gender, Labor, and Social Development. So, Patricia, you're welcome. They've given a leeway for you. Thank you.
Thank you so much, Stephen. Maybe so how this will work, maybe we'll hear from you. You could have questions or comments or recommendations. There's a question over there.
Thank you very much for having us in this dissemination meeting, but also for sharing with us the findings from your study. I have a few questions. The first one is around in your methodology, you interview parents and children. Just want to know if there was a same space to separate them, because they are how much information children give you. The second one, I think, is on what are the three big surprises, things that pop up new might be used to us. And then the last one, we talked about trying to explain what the parents do or not do. You might recall many of us become parents either by accident, you find yourself as a parent. We practice what we have learned by observation at home. If you are happy to follow at home, if you are in a home where the father was absent, so as we are talking about the aspect of parenting, where do we go to talk about? I think that is something that I want to stop there.
Thank you very much. Thank you, Minister of Gender and Social Development. My comments are on the recommendations. You can see we have over-limited ourselves in terms of the recommendations. For instance, when you say target rural areas for PCC interventions, I personally think I'm looking at it from a broader perspective as a country, that we should not only consider rural areas, but maybe the best one to use is areas with unique features, like the hard-to-reach areas, the landing sites, the refugee settlements, things like that. Not only rural, but even those others with unique features that I've mentioned are really lacking in terms of SRH services. Then in the previous discussions, we have already had participants commenting that we have over-concentrated on the girl child and completely forgotten about the boy child, which is true. And when they grow up, of course, they'll definitely live together. But still, I can say again in the recommendations, we are still emphasizing targeting female and girls, which I think is not proper. In any case, I would even have expected you to recommend that we target the boy child as well. Because for the girl child, it looks like it's obvious. There are a lot of efforts, there are a lot of interventions, and a lot of things being done around the girl child, and so little, so minimal indeed on the boy child. So I would like us to expound on that recommendation, probably, if you agree with me. Then the other point is equipping Muslim leaders. I don't know what the basis of this was. Is it because you had the religious institutions in the engagements were Muslims? I think all religious leaders need the engagement because they all speak to multitudes of people. I'm a Catholic by faith, but I want to tell you that I believe in my priests a lot. The homilies they share with us on Sunday in church, I reflect on them a lot, we listen to them a lot. So I just think we should expound it further and say religious leaders, not only Muslim leaders. Then target Busia more. I don't know if you base this because you did the research in Busia and Tororo, but all the border points from a broader perspective, I'm talking as Minister of Gender, you know, from a broader perspective, because for us as a ministry, we look at the country at large. And I'm sure these recommendations are going to inform so many other research areas to different categories of researchers. So all border points have a lot of issues. When you go to Mutukula, the story is the same. When you go to Elegu, the story is not different. When you go to Katuna, so Instead of saying we target Busia more, maybe we need to consider to expound on that statement and say, since this is going to be read by several people and several researchers, so people can take interest in different other points, not only Busia. Thank you. I raised my point.
Thank you so much to all our presenters. Jackie from Children at Risk Action Network. My question goes back to the first presentation because I thought it would have been tackled along the way, but I still have a question there. So out of the 35% that was mentioned to have engaged in sexual activity in the 6 months that the research was done, I wanted to find out how many of these did we actually find out if it was consensual or if it was defilement. Thank you very much.
Thank you for that question. So many of my questions have been asked, but I want to comment that UNESCO is contextualizing a tool for religious leaders and cultural leaders to deliver SRHR as they do their core, which is the religious roles. So I think we should consider probably if we are to train the religious leaders to pick or borrow a leaf from that tool, I think it will be helpful because it is being adapted from the tool for Africa. Thank you.
Thank you. Mine are just two observations. One, I was just thinking loud that after this, what next? Could we maybe have, in terms of what Boka said, maybe developing a publication and then share widely, because my concern is wide as an authority. Then the other second point is on participation, child participation. I know my sister is a guru in that area, but looking into issues pertaining to child participation or meaningful child participation, I know as government, the ministry has spearheaded a strategy of child participation. But still, I thought we would maybe reflect a component of child participation in the recommendations here, so that at the end of the day, maybe we don't need to go to refer so fast, but at least you article looking into it by ensuring that we create maybe a safe space for children, adolescents, where they can easily talk, get ideas, and are empowered, actually empowering them, so that they can be in a position of saying no, for example. Thank you.
Yes, thank you. I just wanted to start with an example. I have a sister of mine who has only boys, but I also have girls and boys at my home. So when the boys visited my home, they're around 7 to 6 years. They saw when they went to bed, they saw my girl, and the boy had to tell the mother, "Mommy, this one has no susu." And he was like, at 7 years, he had never seen a girl. And her complaint was, this one has no susu. So these things happen in our lives. Another issue is about when I got married to my wife, there was, for sure, there was a very big difference between me and my wife because of the upbringing. I learned that abstaining was very much important at our home. So I abstained up to around 25 years. So my wife was like, how could you abstain up to that age without having sex? So she used to take me around and told me I had never gone to that lodge, even that hotel I would have been through. So things keep on changing. So I started growing until up to now we're having a happy marriage. And she learned something that someone can be grown and I was staying at home, and we are keeping it together without children. So lastly was equipping religious leaders. I think UNESCO has done something about that, and UNICEF has started projects on children in different religious perspectives, the religious faith-based organizations. If we can work together with UNICEF and UNESCO, we can be a better community.
Thank you so much. The presenters have comments, but also a point of information. National Population Council, National Planning Authority on an annual basis conducts assessment of local governments on how compliant they are in terms of integrating demographic dividend indicators in their plans, as well as implementation in terms of reporting. So it is good for us to have this information because it will give us maybe more ground to argue out why districts are scoring the way they are, but that is specific for Toro and Busia. Then back to the presentations. These are my thoughts. I was thinking that maybe we could try to move away from the previous participants talked about us having to go to different border districts, but is it possible for us to also go to other districts that may not necessarily be border districts, but maybe adopt best practices that we can actually disseminate to other districts? Then the issue of then the other one has been talked about, the role of peers through the participation of young people. Thank you.
Thank you. I'm rich from the children. I wanted to compliment what Madam Masula said about targeting the girl child. The boy child, I think boys in the community, they are usually not aware of the value of a girl child. And there's need for awareness among them so that they can value. For example, you may find, like for us, the youth, there is someone speaking with your sister, and you know this person, and you don't take it for granted, you don't mind about it. But if someone educated this boy, value the young child, I think they will try to protect them more, and this will reduce the number of violence and how the young child will be inside. It is time to respond.
Perhaps be responding to some of these. So I'll start with, unfortunately, I think Mr. Augustine has left from UNICEF. He asked about the methodology, parents and children, were they in the same space? When we went with households, we would ask for consent from a parent and also for the child who is within the age category we were looking for, okay? So once the parents consent and also we are able to talk to the child, we would ask for privacy. If the parent is able, we talk to them there and then get a separate, maybe out in the compound where we are far away from adults. The parents like reach, they wouldn't hear what we're discussing. We made the children as comfortable as possible, so they would speak freely and openly. We also did interviewers of the same sex. For example, if you went to someone's home, a parent would be very uncomfortable having had the daughter being interviewed by a male research assistant on such a sensitive subject. Okay, so we had female research assistants speaking to the girl child. We also try to have more, say if it's a mother being interviewed by a fellow female research assistant. Some men would be very uncomfortable having a male research assistant interviewing their wives for 1 hour, really, what is that discussing? So we took that in mind. What are the 3 big surprises from our study? Stephen will talk about that. He also told us to reflect on issues to do with parenting. What is it like? How is our parenting style? Some of us become parents by mistake. So how are we going to be role models to these children to ensure that, they also grow up as straight children, despite our backgrounds. Madam Wasula gave a number of things, and most of them will be expounded on in our write-ups. So we've taken notes, things about using, mentioning these are unique areas, but they have unique features rather than target rural areas. We'll handle all that. Someone asked, was the sex consensual for the 35% who engaged in sex? Maybe some of you may not know, Tororo has one of the highest defilement cases in Uganda. I think it's the second in the country. So really most of the sex there is non-consensual, but even this komatanga they talked about, this is a very common practice in eastern Ugandan districts, where even people's wives who have gone for this fundraising are usually raped by young boys. There's defilement, so most of this is not consensual. We happened to interview the resident state attorney of Tororo, and we got all that information. She had a pile of defilement cases for children as young as 7 years. Yeah. Mr. Chizas talked about what next after this. We are rolling out a number of publications of this work. We have very rich data, and we believe even these findings or what is coming out of here will be used to enrich some of what we are going to report. And we shall probably contact some of you on the sideline on how we can improve or probable explanations of some of the things we found. Then, thank you, Zoe. You talked about adopting these best practices for other districts. That's a very good recommendation. We know that not just border districts are having these issues, but even here in Kampala, in Wakiso, where we have urban parents, they are busy people, they are hardly there. So even these, we've seen girls get pregnant even here in Kampala. Yeah? So, and have this rolled out. I'm sure Ministry of Gender has that. And I could have missed something. I just wanted to say that while we desire to have general recommendations and stuff that respond to the whole country, we also need to remember that we need to be setting, because because they also need recommendations that they had applied. That's it. So some of these specific aspects, like for instance, the Muslim, more interest in the Muslim, it came out actually in that statistical test that there was less focus. So if somebody has an intervention in that area, that's where they place emphasis on that. Otherwise, I think nationally, everybody, I even mentioned one of us, was the commissioner who said, how many of us have 10 to speak to our people? I think all of us are in accomplice or vulnerable. So, yeah, but these ones were direct from the statistical test. So we thought whoever has intervention would focus on that. But for sure, at national level, I think your comments are hard.
Thank you. Augustine left, but he had raised question that were there new themes or surprises that came out of the study? I think yes. Before I shared with you that we, as a ministry, we didn't know that we have mothers who are migrant workers spending 3, 6, even up to 2 years as maids in the neighboring countries with the consent of the husbands. And the husbands also now taking over the role of both mother and father. But unfortunately, some of them are grandparents. They either neglect, abandon, or some of them gray end in incident where they find their own way. During COVID, our child helpline gave us a lot of surprises. We found out of over 3,000 cases we received pertaining those violations of rights of the child, over 300 girls were defined by their own biological fathers. And what is that? The surprise is that there is an element of mental and psychosocial challenge in our families, which now the Minister of Health is saying, no, the mental and psychosocial challenge should not be with us as a ministry, but she's the national challenge. What explanation would one give? Men really defining their own products because they were with them in their own homes. That was the challenge. Then two, vividly from the study findings, we have found out the level of knowledge of parents and children did not differ significant in regard to the variables. You looked at what Dr. Stephen presented. And you remember, they were interviewed separately. But the parents didn't know what the children knew, and the children didn't know what their parents knew, but their level of knowledge is almost the same. To us, that was a challenge. Meaning, a new finding, meaning, even where we have been hiding our heads under the sun, saying things, these children don't know anything, that it's too young to talk to them. But from the age of 12 to 17, you could tell that children know about sex, and they have practically been practicing sex, the 35%. Now, yes, another supplement. STIs. I could not imagine in my years having an STI. But now you see the children of today, they say they have STIs and they know the symptoms of STI. You know, that the bad smell and the abdominal pains. They're getting these things, they know them. So if they have children, you are taking for bacterial infection when that says they have infection. So for the health workers, the parasocial workers, the PhDs who help us as the government in regard to house visiting and case management, some of the symptoms treatment display are related to STI infection, other than the conventional malaria, infection, respiratory infection. You know? Now, another challenge. Okay, those were some places. Now, he also asked about, but that one has been answered. We lack some role models. And I must say that one of our
colleagues here saying, in most cases, culturally, we do what our parents eat. In my local Ovachika, they say whoever is to marry, first do standard research. Rules they translated the share of Muslim. And what did they mean? They wanted those people who lived before us were telling us that be careful. And even scholars, a friend of mine has recently written a book at publication called Money Matters. And he said the worst mistake you can make in your marriage, in your life, is to have a wrong spouse. A wrong spouse. If you have a wrong spouse, you are a professor, you have a drunkard, so let me say, I don't know you as perfect, you are finished. Where is the never begin? So, in most cases, I was a probation officer. There are some bad traits that cut across generations. You say, but where did this branding is coming from? Then they say, even the grandfather died over. You get it? Even the grandfather committed suicide. The social and social politics here would agree with us. So in our homes, when I am in my family, I always challenge my brothers and I say, from my fathers, I'm the only one who is maybe not a pregnancy. But I have a brother who has married and produced children up to 9 wives at the age of 48 years. Then when I said, what is your problem? He said, but our father was a pregnancy. He married up to 4 years. You get what I mean? So in most cases, be careful. People do, especially men, what they saw in their fathers. If the father was very fond of violence, don't read out. Any something more will trick this spouse to be a violent person. Now, 35% having it, whether there was consent or not, all that we categorize it, and especially those who are doing the final editing of the book, that is the final. There is nothing like having consent and all that. You only need to say 35% of that they were up and be fine. You know, if we were to go by law, everybody here would be accountable. When I was a probation officer, I would go to court. The girl 17 has abandoned a child. One had dropped the child in a pit free. And I asked the magistrate, Your Worship, would we be here looking at this girl within the ambit of the law, or we should first look for the one who defied it? And they would agree with me. And whenever I would be submitting, I would say, you should not going to be charged with the defilement, but even you should refund all the money that was incurred by the caregiver, in most cases would be Brandy, looking after this girl of 17 up operation and even keeping her in hospital. I was another abstain there in terms of interpreting the law. So all these, we are not saying we are going there with looking for everyone, but all these children are victims of violence, of defilement, which is another form of violence against children. So the issue of consent, we should be clear as we write our book. Martin, Director, National Children Services. Just wanted to add you one surprising result. When you look at the cascade of the results, you realize that about 6 out of every 100 adolescent children, and these young children, they have had an unprotected sexual encounter in the last 6 months. 6 out of every 100. Surprising and an area for. And I want to end with the Director Martin, National Children. Martin. Say what next? What next? I think that's why we're here. We have this information because one of your area is you are going to use this research study findings. You explain the message. I remember many years back, I did a study on static growth and its effect on sustainable economic development. But for the last 20 years, I've been kind of using those experiences to change the thinking of many local governments. And I was answering the question shared by then. Why we shared by then, and I think up to date, which is a home basket still 38% of students below 8 were studying. So we can use this study and we come up with a lot of messages, a lot of advocacy, and also share. But I want to quickly give you our thinking beyond even the Makerere. One, we are thinking of having another level brief to selected ministry top leaders. I suggest Lydia is here. We present these findings to the National Interministerial Committee, which you coordinate, where Martin sits, Augustine sits, Makerere is represented, institution is academic by Professor Onakila, and also we have commissioners, and the staff commissioners, press officers from the Attorney General. So the issues of, for example, filing, those are issues where the Attorney General and Minister of Justice, Constitution, Police should be also here. The issues of HIV, I mean, testing 6% of the children having unprotected sex. That's all of us, especially many. Then, from what we gather at different points, we can come up now with a high-level policy brief, not only informed by this study findings, but other study findings, whose findings are there in books, and if we find them credible, they can inform our high-level national policy in regard to the security, the care and protection of our children, up to cabinet level. And we are going also to ensure resources permitting, or we can mainstream in our future engagements with the Parliamentary Forum on Children. We want them also to hear the issue of women. Women are women. You know, people are worried about our children going and dying, the youth are out. But how many are we losing in the neighborhood who are there categorically as maids? We don't know. So that also should be taken into where it belongs. Lastly, Martin, child participation. You know, we have a national child participation strategy, and UNICEF is supporting us. I think I have approved the series of so many consultative meetings, and all these things will be shared there. And when we come to have the national child parliament again, these are issues that children will be articulating on their own. Remember, children did very well during COVID. Lydia, you know how you worked with NGOs, children will be on NTV, NDS, and they really inform the country what they were going through. Practices, disseminating, yes, good. We have an area where my commissioner, we are targeting the setting of local governments. Like we have had an interface on early integrated childhood, integrated in the district planning, because we managed to be supported by UNICEF, Ministry of Local Government, to present before the quarterly meeting of chief administrative officers. We have the quarterly meetings of the local government, I think, associations. All of those high leaders, we want to package this thing in a manner that is so simple for them to understand and relate to investing in their own children. There is a book which has been written, 2021, The Costs of Not Investing in Children. I will share with you. I will share, Martin, when you are sending this report to all. It's very, very interesting, very recent, and it brings out all these issues. That's what we want to operationalize the law by saying the immediate consumer of these findings is not even us at the national level, local governments. And that's why we had to bring the COW, the RDC, the chairperson, the religious leaders, not Muslims, they were all there. In the whole Busia, the DHOs, the professional officers, the district community development officers, and others that we deal with. Maybe a recommendation which came out that we need to capture finally. How do we bring the private sector in all what we are talking about? Because the informal trade there, these people can also be targeted through a formal arrangement, and we bring the sales force, the government, the academia, and the private sector on one table to address the vulnerability we witnessed from our findings at the board. Thank you.
Even you want to engage the people, right? Thank you very much, Martin, for moderating, and thank you, Mr. Gavirano, for deliberating to give next steps. I like that question. And thank you, Mr. Chiza, for raising that question. It's a big one, and I think we are headed in the right direction. There were quite a number of questions which were raised by the online audience from about 10:45. I went through some of them, and I just want to give a very quick response. And maybe colleagues here can also complement or supplement where I do not do well, but I believe I'll try to do a good job. There was a question about cultural factors. Did we integrate cultural factors in the study? I would say in the survey, not so much, but in the qualitative interviews, it was highly reflected. We will have actually a detailed report, which when it's finally done and peer reviewed and approved, we will share with all the stakeholders. So part of the answer to what are the next steps, as a team, we are finalizing the report, which once it's ready to be shared by all the different stakeholders. So at least we have all the emails of all of you, and we can quickly share it and also deliver hard copies. So that's something that I want the team to take note of. Secondly, we are going to have a policy brief, which will also be shared. It will be like a summary of the report, maybe 2 to 4 pages max, to be able to share with the rest of the stakeholders. So cultural factors, yes, we have in the qualitative interviews, there's a lot of stuff on that. The detailed report will reflect some of those. Number 2, there was a question about sex activity, 24%. Did we disaggregate it by age and sex? You know, when you're dealing with a small sample size, 600, if you start to disaggregate by age and sex, you lose, you start to find challenges with the smaller area estimations. We will try to do that and see how that plays out. Perhaps that is an opportunity for the detailed report. And I would request maybe Patricia or Martin to take note of this. The bit for age and sex disaggregation when it comes to sexual activity. Then there was a question about contraceptives and how religious issues are connected. I would say that I think in the qualitative findings, that's where we have some glimpse of ideas, but we did not have a full-blown questions about this. Recommendations, we have age-appropriate messages. I think recommendations, there were so many questions from Lydia, and they were very nice. I actually need to say that the suggestions you made are very good. I took note of them. They were very good suggestions. They were very, very nice comments for improving the report. So that's not that we will try to take note of those observations. What about boys? There was something about boys. Yeah, there seems to be a big concern about the boy child. And I think that in the next engagements, this is something we need to pay attention to. It's something we need to pay attention to. There was so our study found that the boys were speaking to their parents more than the girls. And the question was, how does this happen? You know, when you do research, sometimes there are those areas you find a dilemma and you don't have straightforward answers. And I would say, like Augustine asked, what are the surprises? I think I remember highlighting this, that this is really a surprise, because we would think that the girls are doing the talking. It's a surprise. Maybe we need to check either the data or find
very meaningful explanations for it. There's an issue of how is the integration of SRH in the parish development model, and I think Mr. Fred Gagrano had already talked about that in his presentation of the policy implications. Somebody asked a question about digital proliferation. Is it good or bad? If I got the question well, I think that the answer is yes and no. You cannot just say that digitization is bad per se. There are benefits, but there are also challenges with the digital age. Did we consider this in our analysis? I think we had a few questions about mobile phones, and we had questions about ownership of, I think, television. But we didn't go deep into this thing. But I remember in the survey results, we saw that household owning a mobile phone was a really big facilitator for communication. I think some of the questions that have been raised, we had this one now going to the questions that are still open. There was somebody who needed, maybe there was somebody, maybe Patricia and Professor Kodre need to take note of this. In the chat, there is one of our students, I'll give the name later, asked something that is very serious and I think requires either counseling and sitting to listen. You remember what Dr. Sabrina Chitaka said, we should have a big, small mouth and big ears. Yeah, so I think there was somebody who, one of the participants online, she's our student and I know, so I will not disclose the name for confidentiality, but after this we can talk about it. She said she has challenges as a person, and she's nearly getting into depression. I think those who were on the online chat must have seen that. So that is something we need to take up. I don't know who else could help to talk to her, because that is something, if somebody puts up in the public space, that requires attention. So I just needed to respond to that. I saw somebody try to answer. Ruth said, occupy yourself with assignments and share with a friend who can parent or relative, something like that. But I think this person needs to be heard, needs to be listened to. Monica says, what suggestions does the report offer on the modality of trainings to parents? Yeah, we do not have the modality. I think one of the things which we had was a question about what do they need? And they said they need a curriculum. They need a curriculum. The modality of the training, now initially this grant was supposed to be an intervention study and we had put it in phases. If you remember very well, we were supposed to do this prevalence study and then after that do a randomized control trial and do an intervention actually to train parents on how to do parenting. So when we were asked to revise, we actually took out the intervention bit. So the GMC representative intimated to me that now we should plan for the fourth session of REEF, and she emphasized that we should now apply. So team, you take note of that. But next steps from our study, one of the things which is clear is doing an intervention. We do not have the money. It is a big thing, but Mr. Gavirano here knows how to navigate around the money. I'm very happy that he was saying that he managed to get big money. Maybe with your hand, we will work together this journey. Thank you, sir. Okay, so and then modalities of trainings, I think will come later. Intentional focus on the boy child is important. I think we have had that. There were questions that were raised. I don't know, around 10:45 questions began coming in. I've just tried to scratch some of those. If there are any questions that have been left out, I think we are going to share our emails. For maybe if there's any member on the online audience who wants to ask a question, one or two people would be glad to take at least one person to ask a question. We are about to close, so members, thank you for your patience. We are about to close. I want to invite, if there's anybody online who wants to ask a question right now. I can stop sharing the screen. Anybody online who wants to ask a question? Any participant who wants to pose a question? Okay, we have Ruth. Ruth, you've raised your hand. Please go ahead and ask the question. Ruth, if you can go ahead and pose your question. I'm allowing you to speak, Ruth, so you can go ahead and pose the question. You're muted. Okay, good.
Hello, hello, hello.
Ruth, go ahead and ask your question, please. David, if you can help.
Hello, hello.
The volume is maximum here.
Hello.
Ruth, can you ask a question? We see you unmuted, but we cannot hear you put a question forward. Okay, any other question?
Hello.
Ruth, you can type your question. We can't hear you completely.
Nakayenze Esther. Nakayenze Esther 078. Hold on.
Any other person who is able?
0782 461.
These are all your questions. Ruth, we can't hear you at all. If you could just help type the question, maybe we get another person who can speak.
I have
Monica,
that one.
can you try?
Have got. Let me get back to you when I check and I tell you again. Then I'll get back to you. It's okay. I'll send that.
Okay, we can hear you now. Ruth, you go ahead and ask your question, please. Thank you.
Yeah, my question was, can you hear me?
Yeah, we can hear you.
Hello. Yeah, my question was, one, I want to thank you for the research, and it was very good and it is informing. But in all what you have done, I haven't heard whether you knew the capacity of the parents, because the parents of today are the ones who are the same as their children. Most of these are the ones who got married when they were young, and whether they have the information even to share. So what do among the questions I didn't hear what the parents knew that they would be able to share, and someone brought it out, but it didn't bring out clearly. And how was it easy for those who were discussing to share with their children or the children with the parents, and on what were they sharing, so that it would help us? We are developing a national parenting training manual as a Ministry of Gender. So those are some of the things that as we are talking, do we talk what will be there, or we are just talking out of technical understanding? And then how do we suggest whether it was necessary for both parents and the children to talk about these issues?
Okay, thank you, Ruth. I think that your question is very important. We did not investigate the knowledge levels among the parents, but we had questions about their comfort levels when discussing these matters. I think those are things we did not really go into details. But I think we like the idea that you are doing something about developing the parenting manual. So that's something we missed out. We had Monica. Monica, if you could go ahead and speak, please.
Sir, I had something, but you stopped me on the way.
Oh, sorry. You finish it now.
Yeah, it is only one about the environment in which the children and the parent discuss the information. If I had someone who was sharing about his life on how parenting improved or helped him, the environment, especially in urban, where the parents are sleeping under the bed or up the bed and the children below, and they are exposed to so many things. So you find that I don't know how this one, because I'm seeing in your recommendations that we should pay more attention to the rural and the urban when we have different challenges of both, on how, when should the parents start discussing the sexual reproductive issues with the children, depending on the environment the child is growing up.
Okay, thank you very much. Thank you very much. About the environment, I think we found challenges from the qualitative interviews. Some key informants were raising a concern that at the border districts, you find that the parents sleep in a single room with the children, and sometimes the point about the poor model by the parents, it is real implication is that sometimes parents are also involved in extra, how do I call it? Maybe, for example, if you take a case of transactional sex, now that becomes difficult. For, first of all, it's a bad picture for the children, but also it's an inhibitor for the parents to communicate to the children because they are already guilty of what they do. The children also observe. So the environment is a critical thing, especially in urban areas. In the context of poverty, there was another point about poverty from the qualitative findings. We did not just explore the details, but it's an issue, and thank you for raising it up. Monica, we could take one or two more and we end. Monica, you had your hand up. If you could. Okay, do you have another person who wants to pose a question for us? Okay, I think that I would want to say, members who have been online, thank you very much for sending your questions. We have them saved somewhere in case we need clarification, in case you need answers to some of the questions. If they're not well answered, we can be reached out by email and we can have a conversation. Now, without wasting a lot of time, I want to request that we invite Mr. Fred Gavirano to come and make closing remarks on his own behalf and on behalf of the Ministry of Gender, Labor and Social Development. And I would say that after his remarks, we have some, for those who are here present, we have something for lunch, if you come for lunch. So make sure you see Professor Kwagalo to have that. Okay, and then make sure you see Dr. Nduga Patricia at the back before you head out for lunch. Over to you, Mr. Thank you very much.
Thank you, Dr. Stephen. On behalf of the Permanent Secretary, Ministry of Gender, Labor and Social Development, once again, I want to thank you for your time, for effective participation in this interface. I had already thanked Makerere, our partners, and all of that. Just to say that this is the beginning of a new norm of doing things. It is business as usual. We want to engage with the academia, with the civil society, with the politicians as a ministry. And I think that is also the thinking of all ministries, agencies, and departments, so that together we can make a big difference in regard to addressing challenges of our people. Without wasting time, I am inviting all of you on behalf of the research team to keep with us. We have our emails. If you have new areas of study, as a researcher, a student, a civil society, share with me. I get partners, and at the same time, I'm in a position to include all what you are proposing, so long as the findings contribute to solving some of the challenges we have, to include that on the research agenda of our ministry, which we submit to Office of the President every year. Martin, for emphasis, I think we need to sit together with Professor Kwagala, Stephen, Dr. Martin, Dr. Sach, the rest, either at their office or at my office or to your office, and we plan together how to come up with a high-level policy brief. We believe resources permitting, we are able to do that. And I'm happy our partners in the child fraternity, UNICEF, was physically present here and they were online. Lydia has gone out. She has gone out, but Lydia, Franco, stand up for. Yeah, the two are seated together. This one supervises the other and also supervise that one. I'm also supervised by a director, direct supervised by a PS. So let us take this study. And in our senior management, we guide the other departments the way of doing things, because these academia do a lot of work. But if the findings don't inform government in terms of what is working, what's not working, and also other partners, then it means the research is not impacting. I was in Japan and the professors told us for them over the weekend, like Professor Kwagala, I will not ask you where you come from, but they drive 500 kilometers, sit with their community members. Then they listen in form of community dialogue meetings. And when they go back, they channel all what they have gathered into researchable topics. Then they also apply for grants, or sometimes they use the conventional support by government. And what they bring out indirectly or directly influences government legislation and policy. All of us here, you have heard where they say we have very good policies, we have good programs, but they are not impacting on the people. What is the missing link? For us, we believe we demonstrated right away from the entry point in Busia Tororo that is doable, Chisoboka, and we have done it. And it would have been bad if you had not invited the partners. Those from the CSOs, you have heard that in regard to disparity reduction, if you are not careful, you could be one agency and you focus in one district, yet the suffering is more pronounced in the neighboring district without your knowledge. Districts, we are guiding them that when partners come through the district technical planning committee, even through the district executive, focus resources, meager resources on addressing social ills in those areas that are most disadvantaged. But we have had a situation where partners concentrate in one area. I know, I had worked in Tororo. I know there is a lot of NGOs compared to Busia. So in terms of policy reform, even Franco, at the NGO policy level, we need to look at the NGO and engage the NGO board. When they are approving NGOs that are saying we want to go and operate in districts, can we have kind of a fair distribution of this civil society instead of you approve everything? Because NGOs, in my view, also should be awakened to really balance the boat. Why would a lot of concentration in Tororo? And then Busia is underserved. So that one is a high policy issue, which we can take on, do another thorough analysis, and inform government accordingly. And in subsequent reforms in terms of policy and also the NGO Act, we can look at that. All that said, I want to say, once again, thank you, and journey message back home until we meet again. I hereby officially close our meeting. Thank you.
So the online audience, we thank you. Feel free to exit. Thank you.